to the dermatologist. And we added beauticians, beauty experts, and estheticians to this conversation because we know that we are people that love beauty and love to, we love to take care of our skin and our hair and our nails. And this is in the purview of dermatologists because many people may have a hair problem or a skin problem or a nail problem and see a beautician first, and they may not know that they're meant to see a doctor, because I know a lot of people that have hair loss, they ask for advice from the salon, the hairstylist, and don't realize that this might actually be a medical condition. So we want them to also be aware of some of the common conditions and what to do when seeing people that have these conditions. So, sorry, we're just starting abruptly. I haven't introduced myself, I realize. So my name is Dr. Folakemi Cole-Adeife. I'm a consultant, physician, and dermatologist at the Lagos State University Teaching Hospital, LASUTH. And with me also here, we have to just introduce yourself so we know who is here, whether you're in what hospital you work, what's your designation, and then we can all get to know each other. So thank you. You want to go like that?
Thank you, everybody. I'm Dr. Afuli Hussein. I work as medical officer at the GH Motion.
Good afternoon. I'm Mrs. Adedoku Afunle. I'm health information officer. I work at Mushin General Hospital. I'm Ijoma Chukwu. I'm a aesthetic nurse. I own a beauty spa.
I'm Francis Kejagu. I work in pediatric clinic.
I'm really Shakin Damilola. I work in Lifeline. I'm a registered nurse, sir.
Okay, good afternoon, everyone. My name is Adibayo Oluwatumishi. I'm a registered nurse. I work in a pediatric hospital.
Good afternoon, everyone. My name is Sylvia. I'm a medical esthetician.
Good afternoon, everyone. My name is Okafo Joy Obiageli. I'm a trichologist and I work with a male self-care brand.
Good afternoon, everyone. My name is Seba Machinyere. I'm a registered nurse. I work in Lutz.
My name is Tolani Ojuri. I'm the cluster head for persons with albinism in Lagos.
Good afternoon, everyone. My name is Bessie. I work with Etika.
Good afternoon, everyone. I'm Temitope Adu, a pediatric resident and with interest in dermatology.
Good afternoon, everyone. I'm Dr. Opel Shino, Pediatric Survey Road General Hospital.
Good afternoon, everyone. I'm Amdaola Dejibalekis, a pharmacist at the Lagos University Teaching Hospital.
Good afternoon, everyone. My name is Ogulano Tolulope. I'm a pediatric nurse and I work in precisely pediatric outpatient clinic in Ruth. Thank you.
Welcome.
Good afternoon, everyone. I'm Uzoka Fidelia by name, a deputy director, nursing here in Lutz.
Good afternoon, everyone. My name is Orolua Adeyeko. I'm a beautician and I work with a beauty salon.
Fantastic. Welcome.
Good afternoon, everyone. My name is Rilwan. I'm a hospital administrator at General Hospital Imota.
You're welcome.
Good afternoon, everyone. I'm Mrs. Okoro Benadine, a retired auto nurse from Orthopedic Hospital, but I work with NGO now as an outreach.
Good afternoon, everyone. I'm Mrs. Eniayem B.A. from General Hospital Imota.
Thank you. Are you a nurse? Are you a hospital administrator?
No, I'm an accountant.
Accountant, okay.
Yes. Good afternoon, everyone. My name is Lawal Miriam. I'm an internal auditor, General Hospital Imota.
Okay, thank you.
Good afternoon. Good afternoon, everyone. I'm an admin, the hospital in Mota.
Good afternoon, everyone.
An admin in Mota.
Great, awesome.
Good afternoon, everyone. I'm pharmacist Tijani Adebukola Aderiola from General Hospital in Malta.
Good afternoon. My name is Ms. Shitu Abiola. I work at Imota General Hospital as hospital administrator.
Administrator, General Hospital in Malta.
Hello, Noza Jova from South Africa, dermatologist.
Good afternoon, everyone. My name is Dr. Akin Kugbe. I'm a dermatologist and I work at Luth. Thank you.
Good afternoon, everyone. I am Dr. Edun Olubumi. I'm a medical doctor with interest in dermatology, and I work at Aurelia Agege General Hospital.
Good afternoon, everyone. My name is Adebo Ali Timlane, and I'm a dietitian working at Lasut.
Good afternoon, everyone. This is Victoria Abanova. I'm a medical support officer and physician assistant. I'm an esthetician also and a public health researcher.
Okay, has everyone introduced themselves? Yes? Okay, fantastic. So before we start, maybe for the camera and all that, they've said, please, if we can come forward a little bit, if you don't mind. Do you mind, please? Sorry, we can fill up the front seats and just move forward slightly. Thank you. Thank you. Thank you. Yeah, if you're back, please just come all the way to the front here. So you can also see better, okay, more clearly. Okay. Please come to the front. There are still seats here. You can just move up a little bit. Thank you. Yeah, you can move up. Thank you. Thanks so much. Right, so, okay. Awesome. Now, we would like to start with, I've spoken about World Skin Health Day, and then I wanted to go further to discuss the theme for this year. In Lagos, we're having a project called Skin Health Beyond Skin Color. And we were just coming in from Mushi Market, where we went out into the marketplace to talk to the market women about their health, particularly their skin health, and against harmful skin bleaching. And so let me just see if I can get the slides up. But we know that skin bleaching is a concern in Nigeria, or are we not aware? Yes, yes, it's a major concern amongst people here. It's estimated that between 40 and 80% of people in Nigeria, use one form of lightening cream or the other, or have used in the past. So we are sometimes referred to as the bleaching capital in the world. I would also contest that a bit. There are some countries that have higher numbers in Asia, but when it comes to Africa, I think we tend to always be found at number one. So we decided, and the dermatologists are very concerned because increasingly we're seeing cases of the adverse effects of skin bleaching and skin lightening in our clinics, and some of the side effects which we'll be talking about as well. So we really need to have this awareness, education, and so we have been to the university, Yabatech, to the market, and of course we must involve our health workers who can, who will be able to see these patients first and understand how to counsel them when they come to you with certain signs and symptoms, because they may not always come to us immediately, or if they do come to, by the time they do reach us, it's quite late in the day. So if they do come to you, you can, know how to advise and advocate for them. And then the second thing is the use of steroid creams, which is also a major problem. We see a lot of people presenting with the adverse effects of skin lightening, skin bleaching, the adverse effects of topical corticosteroids in tube cream, triple action creams that we prescribe quite often and are readily available everywhere, in the pharmacies, in the supermarkets, in the roadside store. And some of these potent corticosteroids are very harmful, and they should only be used by the strict supervision of a dermatologist or a health professional that understands corticosteroids. So that's the other thing that we'd like you to talk about today. Before we start our presentations, I would just like to call on a few people to say a few words. I would start with our very special guest, who is a distinguished professor of medicine of dermatology from KwaZulu-Natal University in Durban in South Africa. She is a fantastic dermatologist, a wonderful mentor to dermatologists across the world, Africa, Europe, and she's made great impact in bringing up younger dermatologists and making them to be more interested in things like this, global health outreaches, research, development. So I would like her to come and say a few words and say hello to us. This is her first time in Lagos. She's been to Abuja before, but in Lagos this time. So Professor Oza Nova.
Okay, a castle. Hello, everyone. As Fola has mentioned, I'm from South Africa, Durban, and I have a lot of friends and from front and Rere. So it's really been a pleasure for me to come here to Lagos. I've never been to Lagos, but I've been to Abuja, as they say. But it's been such a wonderful experience for me. We went to the market. It's been such a colorful, dynamic, vibrant place. So it was great to experience that. So, and I'm glad that my colleagues have been able to arrange this meeting and set up, which I really support, because skin bleaching is a real challenge for all of us, and it's up to us health workers to promote healthy skin practices. I think we mustn't allow commerce to actually influence our consciences. Skin bleaching is a challenge. We did a study in South Africa and in a hospital, a cross-sectional study, and we found that I think 33% of the people were using skin bleaching creams. But in Nigeria, it's actually double that, and which means that we as Africans and healthcare workers have to try and motivate and speak against and show our consumers that skin bleaching is a challenge. And skin bleaching these days, it's affecting young children because their mothers think that they have to bleach their children. It's affecting men. It's women as well, because women think that if they are lighter in complexion, they are much more attractive, and the chances of getting married or getting jobs are higher. It's actually not true. I always say to my patients, if I were to go to a supermarket, I don't know if you've got checkers here in South Africa, I mean in Lagos, and buy a type of skin, the type of skin that I would purchase is the darkest of them all, because that is the most beautiful skin, the most resilient skin, the skin that God gave us to protect ourselves from the sun. Because Africa is very hot, and there's a reason why our skins are darker. And if you now remove the pigment, you actually make your skin much more sensitive and looks like Troy there, and my friend there, Carl. They've got light skin, but their skins are very prone to skin cancer. And again, if you compare myself, I sort of have mixed genetics as well. My skin is much more sensitive than your skin. And each time when I see patients and they come to my consultation room, when they have dark skin, the first thing I say is, oh, you've got such beautiful skin. And they get shocked all the time because the misconceptions right there in social media is that if you are lighter, you are much more attractive. In actual fact, I have to spend more money looking after my skin. I have to use expensive sunscreens. I've got like 5 hats in my car. I have 4 umbrellas in my car, and I always wear long sleeves because my skin is fragile and it's common. I call it common skin, but I call black skin the real skin, black, strong, good skin, because you've got a natural protection factor. And now we have patients. A colleague of mine from Senegal, Professor Lee, and I think some colleagues here have identified patients who develop skin cancer from using skin bleaching. That is so sad. It's a tragedy of humankind. So we as healthcare professionals also shouldn't yield to the pressure. If a patient comes to you and say, doctor or aesthetic person, I want to make my skin lighter, you need to resist that. It's not about making money. And if the patient and you feel the patient won't come back to you, you have to say, you know what, without being judgmental, because most of them don't know the complications of these skin bleaching creams. So you know what, I don't want to talk about skin bleaching, it's dangerous, but I want to educate you about healthy skin practices. And that is the way we should be conveying the message. If social media can propel the message that skin bleaching is good, is lighter, we need to counteract that with our knowledge based on evidence and everything. And I know women, women have got friends and always talk about things. So each one of you, make it your mission from today to tell 100 other women that skin bleaching is not good for our skin. If a man wants you to be lighter for you to be attracted to him, leave that man, because that is not a strong man. A strong man will love you the way you are, the way you were born, because the best skin we have is the one that we were born with. And even with men, I see when I got landed here in Nigeria, I was actually surprised to see every 3rd man I saw had bleached their skin. And it's very hurting for me to see this and to see also young people bleaching their skin. But most of the time, it's the education that we have to propel. And that's why we're here today to talk about skin bleaching, because we need to be proud. We are beautiful in our natural skin. We are amazing in who you are. It's not the beauty outside, it's your heart that makes you beautiful as well. And that's the message we need to convey. And we also want to reach to the schools and make sure that we educate our young children about the issues of skin bleaching. We are diverse. We also have patients with albinism who are beautiful in their own right, but genetically, they don't have the pigment to protect their skin. Now imagine if we are removing the very same pigment that's supposed to protect us and actually causing problems. So let us convey the message and maintain the skin that you were born with. Look after it, protect it. Don't change your skin color. Change your mindset and your heart, but not your skin color. And let us continue to convey that message because there are good products there that are safe and reliable that we need to use for our skins. I think I will end there, Fola, and my message, take-home message to all of you is the best skin that you have is the one that you are naturally born with, and black don't crack, and you've got a natural sun protection factor. Keep it like that and don't change how you are. And it's very easy to see if someone has bleached their skin. The hands look different. You ask them to put their hands against the face. There's a contrast, and that on its own is a problem. But we do know that there's psychological problems, there's social problems, there's political issues related to skin bleaching. But we have to change that mindset and be progressive and say we are beautiful in our own natural skin. Thank you so much, Fola.
Thank you very much, Prof. Rosa Glover. Thank you to all who have come in again. So we'll start with the first presentation. Some people are asking for the link. So on this, there are 2 QR codes. So the lower QR code, you can share it with them. but we'll put it up. Sorry, can you take it off for one moment? So they can just see the QR code. So please scan it if you want to share the link with someone, and then just share the YouTube channel, and they can just join the live stream. Can you see that? Is it okay? Okay. Can you, the lower QR code? Okay. So please, can you put up the slides again? So going right into the focus here a lot today is going to be heavily on skin bleaching and skin lightening, but we are also going to have some sessions on healthy skin, what to do, and also common skin conditions. So we have our program, but we're going to speed it up so we can leave a bit earlier than the time on the program. So skin bleaching comes with a myriad of effects, and as you know, about 2 years ago, NAFDAC declared an emergency due to the state of skin bleaching in Nigeria because of the reports based from the WHO and reports from even dermatologists across the country. And we know that if you walk into any pharmacy, any supermarket, what you will just be seeing is tone, light, white, glow, all sorts of adjectives, bright, and almost every cream, as in before, you even see one that is just normal. Even for children now, you see all kinds of things. And then, I was buying something at my local supermarket yesterday. I saw somebody buying 3 packs of Fombact A. So I was like, what do you want to do with this? But this is the common thing, that people use these things, and we need to really educate the public, because a lot of people don't even know the adverse effects of some of these products. They're using it for a purpose, for a reason, and so we cannot just judge them. We need to educate them. And the consensus is that, as we have 40 to 80% of people, Nigerians, bleach their skin. And so we're seeing a lot more of what we call post-bleaching syndrome or skin bleaching syndrome. In our clinics, I was telling Dr. Anaba one day that about 3 to 4 out of the 10 patients I see, out of every 10 patients, is coming with adverse effects of skin bleaching. Coming down with, this picture here, which is exogenous ochronosis, this blue-black pigmentation. And here you have people coming in with these very exaggerated stretch marks. You have this excessive hairiness, hypertrichosis, as we call it, and then all this acneiform dermatitis. And this is often a very large part of the people we are seeing. And most people don't even, in many cases, when you ask them, are you using skin lightening product? They'll say, no, I've never used any skin bleaching cream. Okay, what is the name of your cream? Bright, white, brilliant, super toning, 7 days, something. I'm like, so they really don't even, either it's kind of a, what they call it, cognitive dissonance, or they are really not aware that what they're using is a bleaching cream. And we see these are the adverse effects we're seeing more and more in the clinics on a daily basis. We've seen some of these pictures online of this is not exaggerated. Sometimes when you're walking on the road, you will see people like this. And these are the adverse effects of hydroquinone creams. And there was one time somebody exported or wanted to import to the UK one of the very popular creams that our people use here. And the person was arrested because they found that cream had 13% hydroquinone. And we as dermatologists that use hydroquinone occasionally to treat hyperpigmentation for a short period of time, we usually don't use more than 4 or 6%. So you can imagine somebody rubbing 13% hydroquinone on their skin every day, all over the body. We see a lot of people like this. And we know that when we go to the markets, we see more. That was why we decided to go and meet them in the market and talk to them. But I'm sure you will see people like this come to your clinics, come to the hospital, even on the wards, And we would link this to even some medical conditions. If, sometimes you might see them on the ward with hypertension or complications of hypertension. And this may be somewhere in the background of, their presentation. So that was hydroquinone. Now these are some of the adverse effects of steroid creams. And with steroid creams, you have several complications. And these steroid creams are usually with high potency or very strong steroids, corticosteroids. And most of these triple action creams contain these very high potent things like betamethasone dipropionate, clobetasol propionate. These are creams that are in most triple action creams have either of those two steroids. And those two steroids are the highest class of steroid and the strongest. We only bring out those bad guns or big guns when other things have not worked. And this is what some people are rubbing on their 3 or 4 month old babies, mixing them with their creams as in their ori as shea butter. Most of those steroids are not meant to be used in people under the age of 12 years, except very, very few occasions. And we find our people using them, on a daily basis. And it's a big challenge because it's increasing the burden of skin diseases. So when I want to come to the clinic and I want to treat people who have genuine conditions that are not what we call afawafa, meaning they are not caused by themselves, we want to treat those ones. But we are inundated by people who have, gotten the issue of skin conditions or fungal infections or discoloration from the misuse of topical corticosteroids. And so you see people with the stretch marks, the discoloration, fungal infections. Now we're having difficult to treat resistant fungal infections. I'll show you some pictures of those as well. Wound healing. My friend who is a general surgeon, she's always in my clinic, bringing her patients to the clinic to say, please look at this skin. This person is scheduled for elective surgery, but I am afraid that if I open this girl, the wound is going to break down. She's going to have dehiscence, and that will complicate the surgery. So she drags her patients to our clinic. Go and fix your skin. Let them counsel you, then come back to me. Those are the issues we're having. Or sometimes pregnant women that need CS, after the CS, you start battling with wound infection because the skin is so stretched, it's so thin. There's no there's no the immune function is low, so infection, wound dehiscence, and everything sets in like that and just complicates things that shouldn't be complicated. As a result of, even there was a case of a patient, they wanted to intubate the patient, the trachea was like paper. And so we now went to research and found that steroid creams cause tracheomalacia, weakness of the trachea. They couldn't intubate that patient for surgery. And it was a case report. It was reported. In many, many instances, we are seeing the adverse effects, not just on the skin, but also in other parts of, other areas of medicine. And this is, where we're talking about even hypertension and diabetes. We are doing a study. We observe that a lot of people who come with long history of skin bleaching, they tend to be quite on the large side, have a lot of stretch marks, have truncal obesity, and we are checking that they have elevated blood sugar, elevated blood pressure, and the cortisol usually will be low to normal. And these are changes as a result of long-term use of steroid-containing creams, having effects beyond the skin. And we know that mercury, which is a very common agent in skin lightening creams, can cause kidney damage and kidney failure. We're having increased risk of kidney failure in our society. Could this be something one of the things driving it? There are many things maybe driving it, but this may also be contributing to it, the abuse of steroids. And these are for patients who are using triple action creams or organic creams. You can see the florid tinea versicolor in these patients. You can see the stretch marks and the dyschromias. And these are patients we are seeing. These are tinea corporis, exaggerated tinea infections all over the body that are very difficult to treat. When you treat with the regular dosage, it doesn't clear. It takes much longer to clear, before the patient has clearance. So we're having very difficult to treat fungal infections. These people are people who have been lightening their skin. Some use the tube creams because they just feel it makes their skin fresh. And this usually is, the outcome. There are so many more, but for time, we can't just show everything. And so I just quickly go because we started late, rush through a lot of the things. So we've seen what is the wrong aspect of it. And we're also going to talk about, the right things. What do we advise people to do? We also have a advocacy toolkit, which we'll talk about a bit later, that you can share with your patient, or you can read and learn how to counsel people when you see these features. The reason why we're showing you the pictures so that you can see the features, and when you see these features, it's important to ask the patient, what cream do you use? What soap do you use? And then you can now take it from there. Because if you say, are you bleaching? They'll say, no, I don't do that. But when you ask them the name, so sometimes we don't want it to be like a judgmental thing, because a lot of people have reasons, and the mindset and the psyche, the cultural norms. So we just want to counsel them. So this one is just do's and don'ts for our patients. What we do and what we should do and what we should tell them when they come to you. Baseline skincare, so that when they come to your clinics, you can tell them this is what you should do for your skin. If you do all this and you still have issues, then there are one or two conditions here and there, or send them to the dermatologist. We did a study a long time ago, and we found that just changing people's skincare products, we asked them to use a gentle pH cleanser, a moisturizer, come back in 4 to 6 weeks. And we discovered that half of them did not come back. And when we tried to reach out to them and say, why did they not come back? They said because their skin issue had gone. So sometimes it's just the wrong skincare products. And when they use the right skincare products, they'll be fine. So basic tips, the do's: gentle cleansing with pH balance cleansers. What do we mean by pH balance cleansers? Soap-free cleansers. You know what we call Syndets. For those, some people may know, but we have some cleansers that are not soap. Their pH is lower than the regular pH of the soap. We have things like Dove, Sebamed, and some other ones, CeraVe. The only challenge with them is they're usually more expensive than the regular soap. So what we tell people is simple toilet soap. Even though those ones are not as good as Syndets, but in the case where the patient cannot afford it, it's better they use simple toilet soaps than use medicated soaps. Medicated soaps are not advised because they will damage the normal healthy flora. We'll talk about that. Now, moisturizing, you want to moisturize your skin, and the best time to moisturize is within the first 3 minutes of bathing. So after a bath, within 3 minutes, you apply your cream, your lotion, or your oil, whichever one you want. And that helps to lock in moisture and helps the skin significantly. Sun protection is important, even though, as we've heard from Prof. Koza, that we are dark skin, we have natural protection, but our skin also is quick to have hyperpigmentation or dark marks. And the reason why we use sunscreen in this part of the world is not to fight skin cancer, because our melanin is already doing that job, with the exception of our people with albinism. We use sunscreen to prevent dark marks and photoaging, hyperpigmentation. Most people will say my face is darker than my body, or I have some spots when I have acne. So sunscreen can help to minimize that, a good sunscreen. But what skin cancer is for people who have lighter skin tones, lighter skin types, because their melanin level is low. But of course, if you decide to do it with your melanin, you might end up having to deal with skin cancer, as we are beginning to see now in some people. So sunscreen is important for us, but I just want to clarify that it's not because we want to fight skin cancer. It's because we want to reduce photoaging and we want to reduce dark marks and hyperpigmentation. If somebody has acne, for instance, and you treat the acne and you don't treat the dark marks, they won't be happy with you. And if you don't treat the dark marks, they go out into the sun, they're on acne medication, which attracts sun to the skin. They will come back to you and say, doctor, you made me black. You didn't, yes, the acne is gone, but my face color has changed. And they won't be happy. And that's one of the examples of why we recommend sunscreen or sun protection to prevent hyperpigment, to reduce hyperpigmentation, and also photoaging of the skin. Now, we also cannot overemphasize the role of a healthy diet. When people come, we tell them, eat your fruits, eat your vegetables, drink a lot of water, reduce sugary foods, because sugary foods are pro-inflammatory. They can increase inflammation. So if you have acne, it can worsen. It doesn't cause acne, but it can worsen acne. And things like milk also, they can worsen acne in some people. They don't cause it, but they can aggravate it. So we try to educate people to reduce refined sugars, added sugars, and eat more of complex carbohydrates. Our local food is fantastic. Our local Nigerian food is fantastic. It's when we start eating all these processed food that a lot of the problems we have started increasing. So if we eat our local diet, vegetables, fruits, and the complex carbs like yam, like plantain, and avoid the breads and the pastas and the ones we like that we give our children, that children like to eat. I won't call any brand name. You know, stringy one like that. Noodles. Those things are refined carbs, and they are bad for the health, and they are also bad for the skin, because your skin is a reflection of your overall health. And if your body is not healthy, your body is battling with inflammation, in many cases it's going to show up on your skin. So counseling people about healthy, eating fruits. When we went to the market today, one woman said, fruits are expensive, which is a point, but sometimes it's about choices. So instead of a soft drink, choose an apple, or choose a banana, or choose a slice of watermelon. And that will also be helpful for your skin. So this is something that you can educate patients, counsel them about. Then you also want to talk about water. I've spoken about water. In our environment, it's very hot, we sweat a lot. Water helps hydrate the body and also can be beneficial to the skin. But some people believe if they drink water only, their skin will be fresh. It's not true. You may still need other things to make your skin to be healthy and to be fresh, but it's additive to those things. Now, the don'ts, these are things that you want to tell people not to do to have a healthy skin. No antiseptic soaps and liquids. Why? A lot of us put antiseptics in our bath water, or we use antiseptic soap. Now, we have some good, healthy bacteria on our skin that helps our skin to function properly. When we use antiseptic soaps and liquids, the skin microbiome is altered. And most antiseptic soaps, they are mainly antibacterial. So if you have fungi on your skin, they will kill off the healthy bacteria. So the fungi will say, yay, we are free, and they'll start spreading. And the next thing, you are dealing with maybe tinea versicolor or some kind of dandruff, because you've removed the healthy, good germs, the Staphylococcus epidermidis, which is a commensal that helps to prevent the harmful ones like aureus, and also controls the growth of malassezia. Malassezia is the fungus that causes tinea versicolor, that causes seborrheic dermatitis and dandruff. But those antibacterial liquids and soaps will not target those ones. They will face the bacteria. So you are kind of doing selective favoritism for fungi on the skin when you use those antiseptics. In addition to that, they dry out the skin, and they make the skin dry. And when the skin is dry, it cracks. And when cracked skin, then germs get into the skin. So it's not good for the skin barrier. So I hope with these few points of mine, I've been able to convince you and not confuse you why you should not recommend septic soap. Some people say, when patients come to them, they'll say, put in your water. It's actually not a good idea. It's not a good idea. So what do we do instead? I tell people to chlorinate their water. That's what is in tap water. If you're not sure about the safety of your water, chlorinate it. Chlorine, safeguard. Sorry, not safeguard. Water guard. Water guard is just bleach. And if you don't have water guard, a little cap of bleach in the water will chlorinate it. Just maybe the cover. That tap water is chlorine that they put there. So chlorine, the same sodium hypochlorite that is in swimming pool water, that is in tap water, you can put it in the water if you think it's dirty. You can also put water filters on your pipe. Those ones that when the water is coming, it will filter it out. That will reduce, germs that people are worried about in the water. These are better alternatives than putting the antiseptics or using the soaps. Now, scrubbing. Most of us like to scrub our skin like, we are scrubbing away our sins or something. And even twice a day. It dries out the skin. The healthy oil and the healthy layer of skin, the healthy film, what we call the hydrolipid film of sweat, of oils, that prevents infections. We are scrubbing it away. And it takes time for it to redevelop. So if you are scrubbing twice a day, that is, your skin is totally dry and parched. So it's better for us to, some people can do without a sponge. If a patient comes here and tells you, whenever I use a sponge, my body is itching me, I tell them, then don't use a sponge. They're like, doctor, I will be dirty. Oh. How can I not use sponge? I said, do I look dirty? No, you are looking fine, fresh. I don't use a sponge. And people are surprised that you can bath without using a sponge. But the Syndet or the soap does a good job at removing water. And if you do need to use a sponge, you can use something soft, like a face towel, that's not hard or scrubbing. So you can tell them, okay, try a face towel. If they say, if I don't use a sponge, I won't feel clean. Because at the end of the day, you also want to work with how people feel. If they don't feel happy about it, you have to look for a safe alternative. So the gentle face towel, soft face towel can serve as a sponge if the scrubbing sponge makes people itch or dry, or they have very dry skin. If you have very dry skin, you shouldn't be using a hard sponge. And then bleaching creams, we've spoken a lot about that. Ask them for the name of their cream. I've never seen a cream that has bleaching on it, but it will have all those funny adjectives that we know: toning, light, white, bright, fright, everything. So you need to advise people not to use those. Now, the triple action cream or the Bobo Niche cream, that when people come to you, they rush, okay, I just write it. But those things in many cases cause more harm than good. Number one, the neomycin is it's a skin sensitizer. So when you use it the first time, nothing happens. When you use it the second time, you have a reaction to it. Gentamicin can be the same. So that skin sensitivity, not for everybody, but for some people, can be very severe. And, there was a patient that once, she did a surgery, she did a mini procedure and went home and started rubbing gentamicin cream. And she came back and it was just so terrible. We do skin procedures all the time and we don't have that kind of reaction. And then we now ask, well, what have you been rubbing on it? And it was the gentamicin that's, so this is something that happens. And those creams have those things. And then the potent steroids I spoke about, which can lead to acne. So you see, you will know when someone is rubbing those triple action on their face. They have a particular type of acne that we call acneiform dermatitis. It's not really acne because they are monomorphic. They are all the same size. They don't open like the way acne opens. They're just bumps on the skin. And that is a sign of, usually steroid use on the face, which is very, very, obvious to us when we see it. There's some natural remedies. The lime, lemon. In many cases, in Africa, maybe if you live in Europe, you can get away with putting lime on your skin if there's no sun. But if you put lime on your skin and you go out into the hot Nigerian sun, your skin will fry because it is a photosensitizer. It's going to attract the sun to your skin and cause burns. Some people said there was one viral post recently that people should use lime for their children under their armpits. And then we wonder why children will come dark, irritated armpits later. They will now start battling dark armpits after they have been the one to put lime on those children's armpits and cause the armpits to become dark and irritated. So it's not a good idea to put lime or lemon, toothpaste, engine oil, and so many funny things that people put on their skin. recently, snails. People say they are looking for natural snail mucin. I saw a picture of somebody that put live snails on her face. Ah. It's nothing. And then organic soaps and creams. We don't know what is in them. They say they are organic, but at the end of the day, when you test them, you find clobetasol inside, and you find betamethasone, and you find mercury, and you find phenols, and they say it's organic. So we really need to tell if it's not labeled, doesn't have NAFDAC registration, you don't have the contents of the cream, please avoid such creams. And if your patients are using them, tell them this is not advisable. We don't know the content. These creams might be harmful to your health. And then herbal remedies, sometimes we see patients and they come and say, oh, they are using some herbs. So the problem with herbs is not that some of them don't provide some work. It's just that we need more research. I keep saying that we need more research about our local herbs so that we can have evidence-based studies about their efficacy. We're not saying some of them may not be helpful, just like what the Chinese did. This anti-malaria that we are using now was a Chinese herbal medicine. And a Chinese scientist went and studied and researched it and proved to the international world that this kills Plasmodium. And that was how the WHO took up that medication, and now it's sold all over the world. So we may have some remedies that help, but we need research to find the ones that work and also look at the safety profile, because something can work and damage your liver, like dogoyaro. You know dogoyaro? It works for malaria, but it is hepatotoxic. So you have to choose between malaria and liver failure. These are the problems. But we need to find a way to maybe make it less toxic and produce something that is safe for people to use. So these are some of the issues we have with herbal remedies. Not that we are saying no, we're saying we need more studies. We need more of our people to go into the lab, do these studies, find out the safe levels and the dosages, and tell us what it is. So our skincare context, once or twice daily, depends on whether the heat, the weather. Right now is so hot, twice daily. If you don't bath twice daily, you'll be uncomfortable. The weather is hot, humid, and everything. Sponge, yes or no? Sometimes we say 2 to 3 times a week. You know, me, I don't use a sponge. I use my hand and face towel once in a while. But other people may not feel comfortable. Shea butter, yes. But the problem we have with shea butter is sometimes they mix it with other things. So plain shea butter, fantastic. Coconut oil can work. Sometimes the storage where they keep it, it might be dirty. So I usually tell mothers, if they can't afford anything else, when you get your shea butter, put it in a pot and heat it. If there are any germs in it, fungi, you will kill it. Then you can cool it down, decant, and use for yourself and your children. So you have pretty much sterilized it, just like boiling water. And that's for people who are indigent, who cannot afford anything more than that. You can tell them to use it, but maybe just sterilize it in case there's any germs in it that might cause more problem to the skin. And then we have our black soap, which some people swear by. For me, I find it too drying for my skin. If it works for some people, it's fine, but it dries the skin, but some people add maybe some things to it to make it less drying. If you have things like atopic dermatitis, I won't advise you use black soap because it's going to make your skin even drier. And we also talk about antiseptic soaps. We use Tetmosol. I'll call the brand name because we use them for scabies. Tetmosol is scabicidal. The monosulfuram is it can help with scabies. But other medicated soaps we usually don't recommend. But if a person has scabies, we do recommend Tetmosol for them to use. And then triple action creams, no. So if you see a patient, you think is inflammatory, give them hydrocortisone cream first. And then if it doesn't work, then we can, look at other things. If you think it's fungal, give a plain antifungal. Don't give the mixed one. If you think this is a fungal infection, give them plain ketoconazole cream and then let them go and come back. Don't give the mixed one with steroids. Then depigmenting agents, we'll talk about that sometimes. Now we have the issue of babies bleaching cream, and they are everywhere. So many of them. It's so terrible. So when you see a child and the child is already having dark knuckles, please counsel the mother, because that child is going to grow up with health problems. There's no two ways about it if they don't stop. please counsel the mother that you don't need to change your baby's skin color at all. Please don't. And tell them what they can use. Gentle old baby lotion that we've always used, or they can use Ori, or they can use coconut oil for the children. And then this issue that people are going on social media talking about 10-step skincare routine, they're just going to irritate their skin eventually. And the skin will end up, not even being fine. The glass skin that they are looking for, rather than glass skin, they will have sandpaper skin, and so it doesn't make any sense because they're going to damage the skin barrier and waste their money. And then a lot of aesthetic procedures. Everybody is doing aesthetic procedures these days, but you need to have adequate training. Aesthetic physicians who are trained in how to do certain things. We've seen people with botched chemical peels. We've seen people who've had infection from IV infusion that they were using to take IV glutathione. And in this IV glutathione, as dermatologists, we don't have evidence that it is effective or safe. And so we don't prescribe it. We need more data. We need more research about IV infusions for beauty. So a dermatologist will not recommend that. But we see a lot of clinics giving it because people like it. They think it makes them glow. It may make them glow, but for how long? They have to keep coming back every month to come and take IV infusion and the hazards that can come with that. So there are other things that can make you glow beyond, those IV infusions. So we are still looking for data to be able to say it's okay. And so far, we don't have that data yet. We don't have the data. And then sorry. So the last slide, take-home message, keep it simple. We usually tell people, cleanse, moisturize, protect your skin. Cleanse, moisturize, protect from the sun. Then you can exfoliate once in a while, and you can treat if as needed. See an expert for treatment. And so we always ask that you refer patients. If you give them the first-line treatment, it's not helping, or it looks strange from the beginning, please just refer that patient to a dermatologist. We have flyers that show dermatologists near you, near us, near you that you can refer to. We made a major omission of Massey Street Hospital. We have our dermatology unit there. But Massey Street, they have their pediatric dermatologist. So if you see children, please remember to send them to Massey Street who have skin conditions. But most of the other locations where we have dermatologists right now in Lagos are on that flyer. So you can refer patients appropriately. Thank you very much. I will end it there for now. And if we have questions, comments, we also have a mini dance drama. But I think we might, if you have any questions based on what we've said, yes, please go ahead.
Thank you very much, Ma. Excellent presentation. I just want you to give a more clarification on hot water baths, because you have different seasons in Nigeria. Like we are in cold season now, and some people even during hot season they still do hot. At what temperature, please? Thank you.
So typically we do lukewarm. We recommend lukewarm water. Lukewarm, just slightly warm. Now, very hot water is going to peel off all the oil on the skin. It's going to peel off all the oil that you have. Just like when you wash a plate that has oil with hot water. It's going to peel off the oil. So very hot water is not advised. But lukewarm water is fine. Some people prefer cold water. Sometimes I take cold shower when I feel very hot. So if the weather is very hot, you can take a cold shower, it's okay. But we would say lukewarm water is just in between, it's fine. Yes, so avoid very hot, scorching water that steam will be coming out of your body when you're having your bath. Any other questions? Yes.
Thank you so much. Please, when you were talking, you talked about the antiseptic soap or liquid. Is there nothing that can be done? Because when you look at them, you see on the body, NAFDAC approved. So how do we do that?
So there are indications for antiseptic soap, right? Some of the indications is that if you are going to perform a surgery and you want to do some aesthetic procedure or surgical procedure, you're supposed to wash your hands with an antiseptic soap because you are breaking the skin barrier. You don't want any of the things on the skin to go into there. But for everyday use, it's not advised. But you see, marketing, people, they can market their products. So they are NAFDAC approved, yes. But we will need to probably in the future have a conversation about for what purpose. Yes, but I know that a lot of people are trying to fight germs. They want, they don't want to get infections. So that's why they use them. But a healthy skin, in most cases, does not need antiseptic soap because we have our own natural skin immunity that fights germs. And then the one that is power past the skin is not antiseptic soap that will treat it. It's other things. So why use it? But, it's something that is a new discovery, research in the last 15 to 20 years. Before, the thought was, let's kill all the germs, get rid of every germ. We don't want germs. But now we are beginning to discover that some of those germs are beneficial. Not all are bad. And so if we take everything off, is a problem. There's something we call the hygiene hypothesis, hygiene theory, that in some countries, they've become so clean that their children and their people are having high rates of autoimmune conditions because their immune system is not exposed to any dirt. So the minute one little thing, the reaction is excessive. So you have high cases of asthma, atopic dermatitis, allergic condition, allergic rhinitis, and things like that. And so they are going back to basics, saying that instead of cement in the playground, put mud. So that children, I was reading a study that in Sweden, they decided to change all their playground back to sand and dirt because they realized that that dirt is helping the immune system of the children. And when everything was clean and fresh, children were having allergic conditions because they couldn't train their immune system. So too much of removing the germs is bad for the health. So the last question before we go to the next.
Thank you for the beautiful presentation. I have like 2 questions. I went to a pharmacy shop and I saw a container like chewing gum or something that helps in the skin. And I like chewing it is inside a container, like sweet or chewing gummy. Yes. And they said it will help the skin. And I also went and I also went to another chemist to get a drug. I saw like something in a container. I say vitamin E or vitamin C. You can add it to your cream and all that. Like if you have a cream and you see some people adding it to their children shea butter and all that. Then thirdly, when I had my daughter, she was diagnosed of having atopic dermatitis, and over time they prescribed Sebamed, this cream from US, what is it called? Aveno, all that, but I noticed that she's outgrowing it gradually. But I still want her skin. She's here. This is my daughter. She's outgrowing it gradually, and I still want to have more knowledge about the pediatrics skin condition, especially atopic dermatitis. Thank you.
All right, we have our atopic dermatitis specialist here. So I'll put her on the spot. She'll tell us all about it and what to do and what not to do. But see those gummies. So now there's a lot of marketing. Just know that right now everybody is looking for how to cash in on the beauty industry. They know that everybody wants to be young forever, which is not possible. And they know that everybody wants to have glass skin and collagen and everything. But most of those things, if you eat a healthy diet, you sleep well, you rest well, you don't need all those extras. Sometimes we recommend vitamin C and E because we know that our people generally don't take fruits. But if you take fruits and vegetables, you don't even need any supplements, to take. So healthy diet is enough. With eat the rainbow, different colors, and fiber. Those things help. Collagen gummies, at the end of the day, they may provide minimal improvements, but add risk to putting pressure on the kidneys because you are just giving your kidneys more work to do to filter out those things. So we don't recommend those gummies, for people. And then, like I said, we will talk about atopic dermatitis. Maybe at, yes. Yeah, okay. So, okay. Last question, okay.
Thank you very much for the beautiful presentation. Please, my questions are just two, and the other one, I want you to clarify what you said about using the IV infusion for aesthetic. I want to throw more light on it. Then secondly, I have a son who is always having itching after having his bath. I advise him about, I will ask him to stop using sponge, he will do, but it still persists. At times you tell me that it gets worse after walking some distance. I couldn't recollect what can cause that one. Then secondly, I have a friend, just as she said, that says is now using organic, natural cream. She made it by herself, I don't know, from carrot or some things. So my own is that, how do you preserve it? Because after some days, it will produce some acidic. How do you preserve it? He said it doesn't need preservation. Please, I want you to just throw some light on that. Thank you.
Thank you very much, ma. Yeah, so for the IV issue, some people actually want to go to the spa, med spa, the clinic, to get infusions with things to, make their skin brighter, or for wellness or rejuvenation. There are many words used to it. While it may have some benefits, we don't have enough data to say this is a good idea. And so we don't recommend it as dermatologists. Some people do, right? But we always work with evidence-based therapies for the skin. And as we are today, we don't have enough evidence of the safety of those procedures and the long-term safety. And also, if it's not evidence-based, as dermatologists, we can't just put our neck behind it. That's usually why we shy away from it, though I know some people may do it. And we always say, it's an invasive procedure. It should only be done by a medical practitioner. If you go to a spa where there's no doctor or nurse, they are giving you IV, it's a risk to life. Because if something happens, they won't know what to do. They won't know how to manage any complication that may arise from an IV infusion. So it's not advisable. And now with the issue of itching after bath, itching, sometimes they may have wheals. There's something we call urticaria. They might develop wheals, which can be triggered by sweating, by change of weather, change of environment. And we do manage those cases. They can be chronic, so the management can be for a long time if somebody has that thing. But I'll advise him to try to see a dermatologist so we can give him a direct or curated management for him specifically. So thank you very much. Dr. Herrera, please. This is my chief from Luth, Dr. Herrera.
Thank you very much. Well done, Dr. Cole. So just to address one of the comments, first of all, this is not for consultation. Yeah, so that's number one. But that's not to say that we can't give any advice and stuff. She had mentioned the increase in allergic conditions in certain environments. And yes, we're seeing a lot of atopic dermatitis, like you kind of mentioned. So thanks for sharing that. I would advise that, you see, you have some flyers, raise up the flyers. We have flyers about where you can actually contact us. Here, what we are trying to do is really, really create the awareness that you can see the specialists. The dermatologists are here. We are not trying to, we can't do it all, but we know that we have to partner with the other healthcare workers. And we have included the beauticians in the list because a lot of people think that skin dermatology is just face. There's a lot more. But if we don't bring the beauticians closer, they may not know who to tell so and so person to go to when there is a problem. We are very, very aware of the fact that the people we deal with, Lagosians, everybody is their own doctor, everybody is their own nurse, everybody is doing one thing or that is not right. But we're hoping that if the people that Nigerians go to frequently compared to us, because we are fewer, because we're not in the right place, and you know that, you know what, this is not, go see them. That's why we are trying to bring you all closer. One of the other things we're trying to do, and Dr. Cole was mentioning, is that if you recognize, because you can't do it all, even doctors don't know it all. We are still struggling. But the one thing we want to do is first do no harm. That's our motto. Primum non nocere. First, do no harm. When you don't know what it is that you're doing, you won't even know when you are giving harm, when you're making harm to people. Many of the things that have been spoken about are very grave. But more importantly, it makes us tired because we are specialists. We're supposed to be digging deep into finding out a few things. But when we are besieged and belabored by simple things that those of you who they meet first are kind of like, I don't know, making it worse sometimes because you don't know, or not knowing when to send them to us, then we can't even now go further in the things that we're actually supposed to be doing. So this is almost like a plea to partner with us properly. That's why we have asked pharmacists, nurses, you know, all of you, healthcare workers, sometimes you don't even have to have a very, very good knowledge, but you need to know who to send this to. So you have atopic dermatitis and you're not sure what to do, they send to us. So we will do something about it, but not here. You have to come to the clinic and then you have this, and it could be anybody, any of us. The rest of the dermatologists that are there can even send to other dermatologists. So some people are experts at this, you know what, go this way. Some people are experts at this, go this way. We're pleading that if everybody is speaking the language of better skin equals better health, we will not be where we are. It's beyond just the bleaching scourge. That's a big thing. But it's also in the way we practice this thing that we're talking about. Everybody is a specialist, skin specialist, skin expert. I was telling Dr. Akinkugbe, for the first time, I had one house help. I had cause to look at her WhatsApp status. And then I realized that, oh, I have a competition. She actually had it there, skin, for skin consults. Is right. I did, I was like, I was really in shock. And I actually saw very nicely done, you know, I don't even have that. And people are going to go. So I actually asked for her scan. I'm like, I'm sorry, what do you do? Mixology. She will mix this, and she says she's training, because they're training models. You know, now Instagram, everybody does a lot of things. So she was taking lessons about how to mix certain things, and she was consulting people virtually. So we are doing virtual consults. My house help is doing virtual consults with me. And I'm thinking, yes, I'm in trouble here. But I'm not the one in trouble. It is the people who would listen to her that are in trouble. But again, you say, please don't spoil my hustle. Because next thing will be like, it's only you that wants to chop. You know, Nigerians, you know, there's a way we have a way of doing things. So you're talking NAFDAC certification. NAFDAC will certify for something. Nigerians will reuse that certification and do more things. We all have to be very, you know, they say shine your eye. We have to be very, very careful. You're going to watch a play and you will see what we're talking about. The ones that are trying to stop it, they will abuse them. That please sell your markets. Leave me alone. But you have to be true to your cause. If you don't know, send to those who know. If you do know, you can discuss it properly with them. Like we said, it's not a shame. No shame. No shame matter. But when we don't know what it is that we're doing, or when we think we know, apprenticeship is very bad. Little knowledge is worse than no knowledge. So it's that little knowledge that we're trying to harness to get better about. So atopic dermatitis is a lot. We'll talk more about that. If you do want to, you come and see us in the skin. I cannot begin to speak AD here. We'll not leave. Okay? Thank you all very much for listening to us. Dr. Cole.
Thank you very much. Yes, so we're going to have a mini play or dance drama. So that it's not just all talk. We can be entertained and also educated. We have the Glow Productions having a short 15-minute play called True Colors. So please, and then feel free to stretch if you've been sitting for too long. Okay, yes, Ma, you asked about natural products. You already answered the question by saying they don't have preservatives. If you keep food outside in your cupboard that has carrots, that has cabbage, that has, what's going to happen to it? It's going to grow organisms, and then they end up putting those things on their skin. So it's not a good idea. There is a lot of science that goes into skincare products. And so the reason why shea butter can work is because the water content in it is very minimal. And that's why I also say, just in case, heat it so that it doesn't have any germs, because it's mainly oil. But by the time you are mixing carrots, yogurt, and food that you're meant to put in your mouth and putting it on your skin, it's going to, if you ask me, now who I go ask, as they say, please let us just, please be careful. And let's use the one that has been created properly for that purpose. So thank you very much. So as we welcome Glow Productions to give us a stage play called True Colors. So we hope you enjoy it. Thank you.
You with the sad eyes. Don't be discouraged, do I realize it's hard to take courage in a world full of people. You can lose sight of it, and the darkness inside you makes you feel so small. But I see your true colors shining through. I see your true colors. That's why I love you, so don't be afraid to let them show your true colors. True colors are beautiful. Show me a smile.
I was shy past everybody for that wedding. My cousin family today fall. But this time, when I enter, them go know say original transformer don land. My skin go shine, so them go need sunglasses before they will
Jesus Christ of Nazareth. Listen, to the family one way, to the family new. Then I saw the motion you have been here. Mommy. What? Please reduce your voice. Dr. TikTok said I should avoid sunlight. Dr. Who? Dr. TikTok. This speaking. Dr. TikTok never pass house job. My cream says no direct sunlight, no sweating, no heat, no rain, no dust. And I stick to my 10-step skincare routine. You really make me say no pretty. Mommy. See, you cannot understand. 5 girls these days do not joke with their skincare at all. Clocking,
Auntie, your face and your body, it no be family again, oh.
No, my face, you see. You don't see my neck too. Now, only you want, One body, theory complexions. You go even resemble Nigerian flag wearing a beat. Look at the CEO. I just think I changed cream last week, and everything just scatter. Kiki, don't worry. Don't worry, I get the one with strong pass that one.
Auntie, I beg, you don't do. Don't act doing this one. This kind of advice put up for trouble.
So we doctor na Baba Jide. Oh, that was.
Make una let air breathe plenty touch the patient, Make una move back, I say move back. Make una come forward small. You no. Move back. And come forward a bit. It's okay. Yes.
Okay, help me. I see the baby.
No worry, don't fear. I don't cure plenty people, and I'm here to cure you as well. Oh yeah.
Baba Jide, who you don't cure?
Now you sabi, if you think I never cure anybody, at least I don't cure myself.
You say yourself. You will never cure yourself. Finish.
Ingredient number 1, lime. Also,
hey, Baba Jide.
Ingredient number 2, toothpaste. Ingredient number 3, bleach booster.
Hey, Baba Jide go be very good.
Oh yes, bleach on the last put small.
Hey, now only small mosquito they take him person malaria.
Now you sabi, abeg. Come on, make I miss my next chop. I go first put lime. I go first put toothpaste. I go mix them together. I go come put my hypo and everything. You go come palace. Yeah! Ayo!
Now who be that engineer when they renovate people's skin for there?
Why are they point to me now?
Not be you.
Me?
Baba Jide, what is this? Now food salad.
Oh no! Now help, now I say make I help.
Help. Now this type of help they carry people come hospital. Baba Jide, you know, the person drink this thing, even their village people will reject that. All this your mixture, I don't warn you, Baba Jide. Stay away from it. I will get back to you. Hey, my sister. So now, how long you don't use bleaching cream?
Doctor, now just small.
Hey!
Kiki, you too the black. Now since last December, since last Christmas. Doctor, now Christmas before the last. So Christmas before. You not too like to the expose
You do the lie, you the lie.
Hey, don't do it. Don't worry, eh? See, nobody dey judge you for here.
I judge you.
Hey, don't do. No worry, nobody dey judge you for here. Eh? See, many people bleach because they believe say it go make their life easier. Some of them they won't marry. Some dey find job. Some won't be like celebrities. And some just want to trend. Eh? But no worry, we will find wetin dey wrong with your skin. But before we get to that, make I ask you, who among una don buy something because advertisement suit? Exactly. That's it. Start. From one bottle to one fine Ukweke model. And then one Queen's English. Before you know it, they go write
In 3 days.
3 days. 3 days. Even bees no go run for 3 days. Why am I younger? See, element, your skin no wicked. Just dey cry for help.
Doctor, right?
Oh yes. See, they cry. When it start to itch, when it start to burn, when it start to change color anyhow, when your skin dey tell you say you don die, I no fit do again.
Hey, doctor, like generator wey dey knock.
Oh yes, like generator wey dey knock. May I ask you, if your generator start to knock, say you go add more load on top, and you go carry am go mechanic listen to them repair am, fix am. Eh? Exactly, na like that the thing be.
Doctor, abeg I get one question. Is it true that fair girls get better jobs?
Hey, how do you know?
Social media.
Social media. The same social media wey say if you sleep with onion inside our salt, e dey cure everything. Na that same social media dey dey cure. See, it is not everything the internet say that is hidden. Opportunity, we no get complexion. Na character, confidence, and skill. Make the open make door. Our color be our qualification. Understand? We try to do better.
Mama T. Your order don't lie. Straight from factory. Direct. Mama T. Correct.
Ghost mode extra white strong. Disappear your darkness 7 days. Mama T, 7 days.
My sister, you did walk.
Hey, listen. Now, when you want to say they don't even write the ingredients for the body, how na they know wetin na dey buy?
Doctor, now Oshapra. Did this.
See, collect this thing. If product dey make person use abi exemplary, no be bad thing suppose to be said. Collect this abeg. See, I dey go work. Won't go meet for hospital abeg. All this stuff na you
Blessing. This one wey you just dey hit this morning, you be snake. Wetin happen? Nothing happen. Blessing my friend. Oya tell me, wetin happen? Kiki, see this influencer. See her. She get new car. She be brand ambassador. She dey travel every month. Kiki look her skin now. Blessing, she fine, no. She fine. See how she fresh. See, Blessing, see. Another influencer. Hey, Blessing, see now. See. Another vacation. Hey, see this one. Another wedding proposal. Hey, Blessing, see this one. Another flawless photo. These people fine. Make I show you another one. See this one. Just everybody just dey glow. Everybody just dey successful. Everybody just fine. Now only me just dey here, they look like charcoal. My friend. See, no talk like that. Make I tell you. You be charcoal wey fine pass plenty candle. Kiki, you no understand. Sometimes as I look myself for mirror, talk say, maybe if I just face small, maybe even if na small fear where I just face, maybe life sef go better. Life go better? Yes, now. Oya, come sit down. Sit down. Life go better. You know say na wetin make me start with that. Really? Now, see, after NYSC, every job interview, nothing. Now so one day, one woman tell me say, my darling, you'd probably look more polished if your complexion was brighter. My sister, I cried that day, water finished from my eyes. Now I begin use cream, one cream become 2, 2 become 5. See my skin. I don't even know my original color again. Try. Blessing. Ma, come and arrange the remaining new creams. Oh yeah. I didn't go. Blessing, what did you go? I didn't go. Master me now. Ma. You don't know say time don't they go. Come arrange them for me fast. How many days they check them? Make I check. Blessing has 4. Yo, arrange them. Make I do that kind of mistake. I never said this. Royal Princess Blue. White Forever. Snow Queen. Golden Glow Supreme. Mama, go they even name all these things where you they say? Now all those factory people now. Mama T. Sister. Mama T. Hey, welcome. Hey. Mama T. I yesterday you get one cream. We can make person lighter before Saturday. Mama T. I won't do my introduction ceremony. And I won't make my husband see me, make him no recognize me. Make a change for my husband eye. My sister. I beg this Saturday. This Saturday now. This now. My sister, I beg, how many days remain? 3 days. 3 days? Yes, now. My sister. 3 days, you know, they enough. Mama, except I go combine for you. Combine? Yes, now special package. Mama T. I go for you, know what? Mama T. Auntie. What's happening now? No buy am. Why? No buy am. Last month, he get one woman wey come here, they combine for her. If you see her face, he arrived before her body. I go lie for you, auntie. If you see her forehead like this, white, and neck, he brown, this ear, he yellow. Hey! Even passport office, he confused. Market spoiler. Leave me. You know say I don't dey want you. My sister. Now my sister. Allow me make I talk. Allow me make I talk. This not because say you be wicked human being. Why you go allow person make you use cream, make you bleach, saute, and husband to be no go feel recognize am. Make on that day make you come dey ask, excuse me, have you seen my wife? E no good now, auntie. If man no go love you the way you take me, cancel that introduction. Now me talk am, cancel that introduction. Now human being then they marry, no be skin. Oh auntie, my auntie tell me say, if I no yellow, my husband he go dey cheat on me. That your auntie get spiritual problem, and she get low self-esteem join. No mind now, come dey go your house, go prepare for your day. Thank you. You be wicked person. Now which? Umbasi, Umbasi. Now my friend. I don't dey watch you. Now my sister. I don't dey watch you. You dey say right. Now why you don't see how we go marry you? You don't pass. Leave me. Don't worry. I dey watch you. Come over here. Now only small. I go stop after one bottle.
Clock it. My sister, we never complete. Why Kiki?
Doctor, she don't come so.
Aha!
Sit down, sit down,
You
sit
see
down.
how my treatment they work for her body?
No be you.
Kiki, tell all of us, how body?
Doctor, much better. Doctor, see, the itching don't reduce. See, I don't stop on those dangerous mixtures since I begin come hospital, and I don't dey follow treatment. She don't change.
All of that now, healing, no be juju, no be magic, na process. Na small by small healing dey occur. Speaking of which, where your daughter?
She don't say she will come here now. Blessing, she don't want to work for your body.
La Kuli!
Wetin happen? Nothing boy. You? Yes. Everything say, maybe if I say small, maybe people go like me. Maybe I go even get better job. Maybe even husband say go come. Instead, see wetin I don't do myself.
Mommy bless you. Leave her.
Doctor, leave her now.
Sorry. Hey, blessing. Now who tell you say your skin no fine? Who tell you say your color no pure? Hey, blessing. Who tell you say success get complexion? Who tell you say marriage dey inside cream bottle? Who tell you say confidence dey inside lotion? Blessing. See, many people wey bleach, not because they don't like their death, na because somebody don't tell them something wey make them feel like say they don't dey good enough. And you see that one, like the real problem.
Doctor, doctor, if everybody don't confess, make I self confess. Doctor, that's anti-aging cream where I dey hide for inside my drawer. Na bleaching cream. Cole-Adeife, you wicked person. And then shut up. No be you carry your money come buy my market. You no go shut up for there. Make I talk my talk. Doctor, you no go blame me. I dey fear old age. I want young pass my customer.
See, you no know. All this cream wey na dey use, people speaking problem or brain problem, even this cream, as na the brain damage, brain failure, it is also skin failure.
Doctor, they want my whole. No be old age dey give person o. Na bad decision dey give person. You go just die. Shut up. You go die. Mind your business. Waiting. I like it.
Chairman.
See mama and pikin.
Wetin dey your bag? Nothing dey my bag. Chairman. Give me my pillow. Give me my pillow. Ghost mode for men.
Chairman, now you buy the last bottle.
Make una no judge me.
I judge you.
My secondary school reunion dey come next month. And dem tell me say my former girlfriend dey come. And if she no recognize me, say I don't change color, maybe she go still fall in love with me.
Oga Chairman, you see that relationship? Now view once.
Now you sabi, no view once. Doctor. I don't look. Go back to we are looking.
I know they bleach.
Blessing, look yourself. Look at me. Make all of una look at me. No filter, no editing, no comparison. Just the way you are. Now who tell you that say the God we create now, we take time, make mistake. And our responsibility, you and I, not be to change to become another person. Now to take care of the skin where God don't give us. Because you see, all healthy skin are beautiful things. Whether he light, or he brown, or he dark. And you see something, everybody now deserve healthy skin. So we can stop all these unnecessary mixtures when they mix with ourselves.
Thank you, doctor. Thank you.
All those old things wey dey say, change am. Healthy product. I hope say with this 1 or 2 wey we don do today, na don learn 1 or 2 things, abi? So before we close, na go repeat after me. You say, healthy, beautiful skin comes in every shade.
Healthy, beautiful skin comes in every shade.
All healthy skin are beautiful skin.
All healthy skin are beautiful skin.
Make we use sense before we use cream.
Make we use sense before we use
We are going to
cream.
talk one more time. Healthy, beautiful skin comes in every shade.
Healthy, beautiful skin comes in every shade.
All healthy skin are beautiful skin.
All healthy skin are beautiful skin.
Make we use sense before we use cream.
Make we use sense before we use cream. Thank you, doctor.
Hey!
Waiting. Waiting.
My reunion.
Ogalala, that's why you have attached your finger and that union I go kill you. I see your true colors shining through. I see your true colors. That's why I love you. So don't be afraid to let it show. I see your true colors. True colors. That's beautiful as a rainbow. As a rainbow. As a rainbow. I see your true colors shining through. I see your true colors. That's why I love you. So don't be afraid to let it show. I see your true colors. True colors. It's beautiful as a rainbow. As a rainbow. As a rainbow.
Just a little jeans and a pure whitey. She never dream forever be nobody wifey. She wanna make her take it, but your heart is on me. Play you like a villain cause she caught in a way. Tonight I am walking away. Line to my mind and I grind,
Thank you very much. I'm sure that was very educative. Yes. And sometimes we need to pass the message through dance and drama. Not every time lecture, not every time presentation. So something light-hearted but with impact. And me, I'm a dancer, so I always put dance drama in anything I'm doing. So let's now go to the next lecture. I'm going to call on my senior colleague, mentor, and teacher, Dr. Aisha Akinkugbe, who is a consultant dermatologist and associate professor of medicine at the Lagos University Teaching Hospital, College of Medicine, University of Lagos. So she has been in the forefront of health education, global health dermatology in Nigeria, increasing the capacity of health workers, various trainings. This year, I'm sure we've had like 3 or 4. We started with training health workers on how to care for people with albinism. We've done stuff with cosmetics, and we are here. So we'll just keep spreading the message of the skin. And so she's going to take us on how the role of health workers, what can you do, and estheticians and beauticians in caring for the skin of our patients and encouraging better skin health with better knowledge. So please, a round of applause for Dr. Akikupe.
Thank you for Lakemi. Okay, so good afternoon, everyone. After that nice drama, I guess it resonated with all of us, something in there, and this is basically what we see every day and how our people view skin lightening and various problems. So it's something dear to us as dermatologists, whereby we know the problems we also see in our clinic. Like Dr. Trafanera mentioned earlier, we don't want to be seeing bread and butter. We want to be seeing the bigger problems because that's why we're specialists. But common fungal infections and little things that should be sorted out, even if you don't sort it out completely, at least recognize it, do a little bit, give a little bit of help, do some do's, and ensure you stay away from the don'ts or encourage them not to do the bad things and then get them to us. That's actually what we want to do. So the role of task sharing and task shifting is what we want to talk about. Which way? Okay. So we all know that skin disease it continues to be a morbidity. Everybody here has a problem. Everybody here will be consulted at some point or the other. Your brother will call you, your sister will call you, relatives, even while you're at church, you're in the mosque, somebody will ask you, as far as you're a healthcare worker, can you help out? Is there anybody here that hasn't been consulted or asked about a skin problem? So there you go. So everybody in here is technically somebody that can help with a skin problem. So we face a lot of problems, but we need to close this gap. How do we close this gap? By training the healthcare providers. So we want to task share and task shift. That's basically what we want to do. People should be able to recognize common skin conditions. Scabies, for instance. Scabies is missed by many people. They keep going around using topical corticosteroids. Pharmacists will give them topical corticosteroids. Your relative will give you, your mommy will give you, your auntie will give you, and then that wonderful drug, that cream, I have to mention the name. I'm not afraid, from Bacte, and Skinil, and all of those things. Then there are problems. That is the beginning of our problems. So we need this to be sorted out. And how do we sort it out? By letting you know, by empowering you with knowledge so that you're aware, so that you're not part of the problem. Falakemi has said it. It happens to me all the time. I'm in the supermarket or something, and I see them asking the boy that is just tapping the till, saying, "Oh God, this one it go work," or this, and they too are recommending. Of course, I will quietly say to them, they know me in that supermarket anyway. I'm always telling that all these things you are selling, you shouldn't be selling. But we can't do anything. NAFDAC is not doing anything. Regulators are not doing what they should do. But you and I, we need to stop the bad practices that we do, and people around us should stop doing it. So task sharing, task shifting, it's a strategy whereby we feel that, these specific tasks that are traditionally performed can be shifted a little, mainly because you have knowledge. So as a nurse, as a pharmacist, you too should, get involved and knowing what is right and what is wrong. And we've been doing this for many years, and we are seeing the dividends. With the pharmacists call us, the nurses call us, they're referring people, they've done this. And it says, above all, do no harm. And that is exactly what is happening. So it has been giving us dividends over the past decade that we've been doing it. And we continue to do it because it's dear to our heart. And at the end of the day, we want to be able to catch bigger problems, deal with bigger issues. Cancers are being missed. Things like inflammatory conditions which shouldn't be managed by non-dermatologists, like psoriasis, things like that. They're going all over the place, and by the time they come to us, they've got a geographical distribution of fungal infections, which you first have to unmask. When you finished unmasking it, then you notice that it's psoriasis underneath. So this will improve healthcare access and efficiency. So these are the common things that are missed, and these are the things that should be identified. Some few things, treatment started, and then refer. So skin bleaching and skin lightening. I'm going to fly through this because Falakemi has dealt with a bit of it, but it's a global thing. So I want you to see, these are all papers from all over the world. It's not just us, but our problems are particular because of the things we do and because of the lack of knowledge, which we are trying to make sure we can do something about. And then there are many papers from all over Africa too, showing the papers. Just look at these, look at the figures. So I need you to abuse yourself or in fact, I don't even know what to say. Just remove that information from your business sense. The pharmacist, look at the numbers. Okay, on bleaching creams that we do. This money could be doing better things. Better things. Asia's whitening market is going, Africa is following, and these are the figures. So why don't we shift the narrative? This is everybody is doing this. This is just outside the College of Medicine Gate, one shop there. Okay, so she's doing her own stuff. What's happening? Okay, I'm not going to talk much about this, the dermatological consequences which she's talked about, but importantly, Cushing syndrome, kidney, immunosuppression. So the fact that you use all of these things, gives your body, makes your body become more immunocompromised. You're more prone to getting fungal infections, and you can't even fight common things. And when it gets worse, you have diabetes when there's systemic absorption. So some pictures of men as well. We see our policemen, you see the people that are out there. You see many people like this. Have you stopped to say to them, you know, someone that's at least close to you that you pass by every day? You should. So these are the effects that we all see. Acne, our young people, everybody is treating acne with topical corticosteroids. That's not the problem. So we need to, you know, try and disabuse ourselves of that dependence on the use of these triple action creams. So how do we tackle this? I've started mentioning this, but we've been doing trainings for doctors, pharmacists, and nurses, and we'll keep doing it, because when we empower you, we increase awareness, where the idea is that all of things will be reduced and you are better informed, so you yourself can stop that trend of using these bad things. So we're fostering this collaboration between the non-specialist physicians, and then just having primary care. We have people here that, you know, where's Dr. Agoro? Dr. Agoro is where is he? Has he stepped out? Dr. Agoro, we did a training when we had this ILDS grant. Please, big ups to Dr. Agoro. Dr. Agoro was one of those that came for the training. And since then, he comes to our clinic every week. He's almost we've turned him into a dermatologist, you know. But the point is, he was equipped with information. He's coming to come and learn more. And that's what we want to do, to ensure that, you know, collaboration and referral where necessary. Okay. I don't know where I meant to point this, but it's not working now. Okay, so next slide. So these are some of this was through an ILDS grant, same sort of setup behind this, where we had the Make Skin Health a Better Place. I can't remember what we said, but that's where we had the training for healthcare workers, both in Port Harcourt, Lagos, and next slide, please, and Abuja. So now let's hear from the audience. I think it's better we make this more interactive. So I'd like everyone to at least, let's have 5 people on this side and maybe 5 on this side. Just say one thing that you know has been a problem that you face, that even we could give a solution to, or something that you face that you're not able to come to some, as a pharmacist, the nurses, anyone. But if we hear from you, then we'll also know what we should incorporate into the next trainings or the next events we're having, you know, that will help us better help you. All right, so I'm coming to this table though. So somebody must put up their hands. It's interactive. If we don't make it interactive, we won't know what your problems are. So just introduce yourself. Tell me who you are as well.
Thank you, ma'am. I'm Dr. Afuleyin from GH Motion. Yes, ma'am. The issue we are having is that some of these about people that sell in the Muslim markets, they have some funny things they do. They prepare some concoction for them. They leave the patient go to them for the complaint of anything of the skin disorder. Before they come to us at all, we will have applied those things first. So yeah, eventually, by the time they get to us, we might not be able to do anything so special, except than to refer. So what I want to advise is that if it's very convenient for you to partner with the public health physician of the LUTH and see the way they can tackle those markets. The people that did some funny things in the market, they have this Agbo market in the Mushin market. Passing through another side. You can see it's so extensive, and they have different sections there, from the malaria to the effect of the skin disorder. So if you can access there, I think possibly you can reduce the effect and the benefits in the Mushin local government.
Thank you very much. So he's raised a very, very important point, and that's the role of herbal medicines and Agbo. Metro.
I wanted to say, one of the challenges we face is that some of the doctors do prescribe that from Bact A or the skinny to patients. So I think they should see to that too. So.
And nurses and pharmacists, all of us. That's why we're advertising it, all of us. But the truth of the matter is, and that is why the training, you see that the training is not limited. It's the GPs, the MOs, they're not dermatologists. Just likewise, the nurses and the doctors. So everybody needs to be, trained so that this can get better. You're directing me to where? Sorry, ma'am. Could you help me pass it?
Thank you very much, ma. I'm a pharmacist, and sorry, ma, permit me to say this. You said something like pharmacists also prescribe, recommend hydrocortisone cream to patients. Not all pharmacists. I am one, and I don't do that. So please, sorry, ma. Okay. One of the issue we have, because I remember now I'm working with General Hospital in Malta. But then when I was working in community, people come and they will tell you this is what I want. No matter how you persuade them, you try to talk to them, they will tell you no. And some will even leave your premise and go to another place to go and purchase it. And we have a lot of, I don't want to mention names, like all these our brothers and sisters. They will sell it. They are just after money. But you as a pharmacist, when you're trying to counsel them, they will not listen and they will leave. So that's one of the challenges. Then, as my sister too has rightly said, that some of our doctors also prescribe those things, and maybe we should just try to educate everyone.
You see, it's about task sharing and task shifting. And if you looked at the people I mentioned, GPs, pharmacists, nurses, even the CHUs, because if we don't get, this is Nigeria. Everybody can get things easily. People who are supposed to regulate are not regulating. But might I ask you, in the pharmacies where you work, do you use prescriptions only? Okay. Yours is GH, right? Did you say General Hospital? Yeah, so General Hospital, you are restricted. You are there, So, but I speak and I stand boldly. My people are here. The people behind us, Carsville Pharmacy, the people around us here, they all sell from back day. Do you understand? So let's not, I think, the way you took it is like, we're not name blaming. You are protected. The pharmacist in Luth cannot sell from back A. The pharmacist in Luth will not sell without a prescription. So you are not that person that I'm talking to, but you stand alone. You are few compared to the people out there. So do you get? I want us to look at it that it's our problem, and that's why we're coming to it. We wouldn't come to this group and keep pushing this narrative if we didn't think there's a problem. And we're trying to solve that problem, and which is why the doctors are culprit. They're here. My medical students are here. My doctors are here. Dr. Agoro is here. That's what we're trying to say. They need to know what to do better so that they stop using that from back day. So it's not a name blame. It's everybody's problem, and we all have to deal with it. So I've answered Matron's question. So over here. Let's hear from someone here.
Good afternoon, everyone. So my question is, the reason why most people would want to use some of these whitening products and cheap products that end up giving them ochronosis on their skin is mostly because it's mostly affordable. Right. So now, when we want to advise these people to discontinue use of this product, what other treatments, what's available for the common woman out there who cannot afford in-clinic treatments?
Many pharmacists are also, like the community pharmacists, are also being trained and getting equipped with information that they can do, so that when you do go there, you do see quite a few of them where they say, okay, do this, you should do this, try this product. And that's what we want, because you can't go into a pharmacy and you should be able to pick up a few things, that you can about, oh, I need something to take care of the dark pigmentation or this and that. But when it comes to treatment, I can tell you that over the last 10, 15 years, the number of dermatologists is increasing. Lagos has the most. They're in almost all the general hospitals, almost all, right? They're in the major big teaching hospitals, and there are lots in private care. We know we're not enough to serve the population of Lagos. That is clear. We're not enough to serve the whole population of Nigeria. And that's why this increasing awareness and education is going to help, so that at least that chain is broken down. You know what I mean? And hopefully, as we keep going on, it will get better. And at the end of the day, we're also trying to share information, because they keep saying, oh, there are no dermatologists. Where can we find a dermatologist? The information is here. So you to spread the word. You also do the right thing. We do a lot of things on air. We do a lot of things on the radio stations. We can't do enough. Our population is a lot. But by training you, we're hoping that the message will be clearer. You too will see somebody near you, the lady, the pharmacist, even in GH or any of the hospitals. You also have the other pharmacists doing the complete opposite to what you're doing. So that's what we need to do. Okay.
Yeah, okay. For me, I feel that this awareness should first also go to our rulers. If we are bringing them, because this regulation is very, very important. We don't have the training for the estheticians. In just 3 weeks, you have been trained to become a formulator, and you will start formulating, putting ingredients one-on-one together for what took somebody 4 to 5 years to study in the university will be taught to you in just 3 weeks. And you will see them making hell of money. They have access to this money to establish and become whatever. So if we can take it to the politicians as well, because they are the ones that will make this regulation and the enforcement of all these things possible. Because without this regulation, all these things we are talking, at the end of the day, how many persons are we in this Lagos and how many persons have been trained here today? So if you can take it that further, so that all this training is to go to TikTok, everybody is a teacher, everybody is training. So once you have learned in 2 weeks, you have opened your own training center and you have started training, and there is now online police that regulates some of these things. There are certain recommendations you will see on TikTok and Facebook. You will like, what is going on? And their mouth is very, very sharp. They speak this Queen's English and train like, you yourself that go to school will not speak the kind of English. And when you speak good English, you are more attractive to some of these things. So if we don't start from there, I don't know, or train us with the Queen's English.
Thank you very much, ladies and gentlemen. And following on from that note, I'm going to take on my Queen's English, okay? So the truth of the matter is, there's nothing you can do. Social media is here to stay. It is for us to take the good things from it and to wipe out the bad things. You've raised very important points, and that is regulation. Even coming here today, so if we start looking at every single thing with regards to regulation, I don't know where we'll start. We're doing an anti-skin bleaching campaign in collaboration with one of the major companies, Eucerin. We went to Alaba Market. What we saw, we're still recovering from. You understand? What we saw. So it's like a drop in the ocean, but you know what? We're going to keep dropping. That's the only thing we can do. So I hear you loud and clear. And we have done things. We've done webinars with NAFDAC. We've had, we keep doing. But at the end of the day, I think when they say the vote is and the power is with the people, we're the ones. So we're just going to keep coming out to inform you, to educate you, to make more. And hopefully we'll get somewhere. But on the regulation matter, we're trying. We're trying. But they are bigger than us. And those industries in Alaba, the West Coast America, it's the money. So, but we'll keep doing our own. We'll start to speak Queen's English. I think that's what we need to do. This table has been quite quiet. Can we have something from here?
Good afternoon, everyone. For a very long time, I've taken time to observe the Africa in general when it comes to skin and beauty, their perspective about it, their psychological take about it, and the problem of skin bleaching. I had to narrow it down to psychological belief. And it starts being from time memorial, from our parents, grandparents. Just imagine, as a child growing up, you already have a bias. The way you're being taken is so biased. If you're light skin, if for example a lady give birth to 2 children, maybe the first one is light skin and the other one is dark skin, the more love is more attributed to the light skin. and that also creates a kind of psychological trauma to these children. So from a very young age, these people start to clamor for lightness, fair skin, and all that. For me, I don't just think it's a problem of regulation and all that. Once the rule is made and the people are not willing, I don't think there is something that can be done about that. So my main point is it's a psychological issue. And if that can be dealt with, at least we have light. Thank you.
Very much. You didn't introduce yourself.
Okay, my name is Victoria. Okay, I'm a physician assistant and medical support officer, but now I'm major in public health, focusing on dermatological skin research. I'm focusing on dermatology research. Yes, thank you.
Thank you very much. So she's really raised a very important thing. And yesterday we were at Yaba Tech with the students, and it was very interesting. Someone also brought that up. It's a big problem. Global colorism, the effects of colonialism. What can we do? So that's why we should, from the beginning, nurture our young men and women to be confident in who they are. Whatever shade you are, nourish it, make it look good, glow. Look on this table now. Milk chocolate, slightly darker chocolate. I'm just like that, dark chocolate. I'm mixed, blah, blah, blah. Just let it look good from top to bottom. That is glowing. And then it's an inner confidence. So it starts from childhood. So like she's also said, we have to do it. We have women, I don't know if there are any of the nurses here from the primary healthcare centers. They are mixing Fombacte in shea butter. So when you say, that's why we say we're starting from, charity begins at home. Before we go to the market, but we have to talk to ourselves in toto. Nurses, doctors, pharmacists. So there's no blame game. That's why we keep doing this, and we have been doing it for the past decade. So, you just have to jump on the bandwagon and not be a part of it. You have to do your own bit because you know better. Last question.
Okay, good afternoon, everyone. Mine's not really a question. I think it's more of a comment. Okay, I wonder why that's happening. I'm Okweshino Pediatrics General, Habiro General Hospital. Now, I think it was last week, I saw a lady came with her son for a completely different thing, and I looked at his complexion, and I said to her, Madam, so there's the Queen English bit that you can speak. If you have some people who are that, you can say that to them. But this particular lady, I said, Madam, sorry, which cream are you using on your baby skin? She said, fair. I just said, stop it. Just stop there. Stop. I didn't let her complete the fair. Is it fair and white, fair and body, fair and glow? You hear fair? And she said, it's not bleaching. It's not a bleaching cream. It's not a bleaching something. I said, I've heard you. No problem. It's okay, mommy. It's fine. Don't use it again. Because this boy's skin is... She went, I said, I didn't judge her, but I just passed information. Is she likely to abide by it? If I tell her to come back and see me, she's likely going to say to me, to make me happy if she stopped, she'll say yes. But then how do I know her yes is yes? I've done my bit. We are the little drops in that mighty ocean. As healthcare providers, you can tell someone if you see. Sorry, ma, don't be offended. I'm a pharmacist. I'm not a pharmacist, I'm a medical doctor. But if you're a nurse, what are you using on the body? She won't take offense because you've already identified who you are. That's the little drop in the ocean. You're waiting for regulation, that's one thing. You're looking at social media, that's another thing. I was telling my friend and colleague, I said, when I was a much younger girl, I'm an older person now. Just as Victoria rightly said, I was 7, 8 years old when I was hearing that, people are still saying it how many decades later? I'm talking about as a child growing up, you were made to believe that if you are light, you have the upper hand vis-a-vis certain things. Well, most of those things are love in the end. But then as we grew older, it now became job interviews. It became getting a contract. It became all those things. Not to belabor the point, as you rightly said, there's a cultural undertone. Go to Lagos Island. I worked in Lagos Island. We worked in, she still does. I worked there for quite a while. You will see young children with a certain fairness that is not God-given. Orange, man, put a color panel. My father's an artist. You will see different shades of fair. And that fair has been aided and abetted by a tube, by a cream. From back there, nori is like normal saline. So me, anything now that has shea butter in it, I'm usually of the opinion it's been mixed with something.
Organic.
Organic, but usually something has been tube infused.
That's why it's
Botanical coat,
organic. It's
and
sold
it's
like that,
mixed.
so it's attractive.
So they'll come and they are the ones that will have the itchy skin, the reddish skin, and all that. We are the little drops of. And then some are hesitant to say, if I stop it, my baby won't be fine again. My daughter won't be fine again. Who's going to marry my son? And funny things like that. But we just have to continue the advocacy, and we just have to continue talking. I was telling Tope, I said, I saw Anokiai. I don't know if you know, how many people know Anokiai. Now, Anokiai she's an American, African American. She is dark. But she's like one of the top models now that is gracing the runways in New York, France, Paris. But she's dark, and everybody's celebrating this. And this was a girl that somebody described as a cockroach once. That, yes, she said a reporter once called her that. But now she's making a lot of money because she's the darkest girl on the runway. Lupita Nyong'o at a time when she came out, she is black. And everybody just shifted that, you're dark and beautiful. So we as healthcare workers have to correct that norm. It is a slow process, but it will have an impact. Thank you.
Thank you very much. Thank you very, very much. So just to end, there are no creams. Like when when you ask them what cream are you using, they usually get discombobulated. They can't remember. So because they change them all the time and they don't want to. But why don't we use fair and brown or dark and brown or something and black? So you can see even the pharmacists, not the pharmacists, the skincare industry, we don't have to use those words, but they know why they're using it. There should be dark and lovely, dark and chocolate, dark and tan. Those are the things that we should use, yes. Why are we using white? Are we white? That's what I tell them. Brown and golden. So those are the words we should use, and we should use them ourselves. We should speak positively to our children and bring them up from tender ages so that they know that they should be confident in themselves and in their color and in their shade of color. So thank you very much. And we'll go to Falakemi.
Thank you very much, Ma. That was so insightful, and it's always great to hear from you, so we know how we can help, where the shoe is pinching, what we can do. And we really need to start from a very early age, from a very young age. I was speaking with my professor from South Africa, Professor Nkoza, and she was talking about going to primary schools to start the work. I think it starts from there, so that if somebody comes to tell them you have to be fair, they would know that they've told you, but mommy, my color is beautiful, all skin colors. And you know how children are now. As you give it to them, they give it back to you. Say, I don't want to bleach my skin like you. Yeah, some children that can be. So if you teach them and they instill that confidence in them from an early age, maybe we'll get somewhere. So I think the next place we are going to are the teachers and the schools and all that, maybe next year by God's grace or so. So we have one last presentation going through common skin disorders, and then we would love you to have photos and all, and we can call it a day. Thank you so much. So I want to call on Dr. Erere Ochofunowe to give the last presentation, which will be on common skin disorders and what we can do. Thank you. Let me get.
Thank you very much. Are you tired? Are you tired? No. Are you tired? No, but the voice sounds like tired. Are you tired? Are you tired? Okay, so just get up and stretch a little bit. Just a little bit. Shake, shake. Where's our brown skin girl? DJ, shake your body. Everybody shake a little bit. Yep. Yes,
She
slow
says she
down.
really
Exactly.
grew up poor like me.
Yeah.
She says she really grew up poor like me. She says she really grew up poor like me. Don't believe in nothing but the She fights it by falling slowly. If ever you are in doubt, remember what my heart told me. Brown skin girl, that skin just like girls. Your fight against the world. I never judge you for anybody else. Brown skin girl, that skin just like girls. The best thing in the world. I never judge you for anybody else.
So yes, we're trying as much as possible not to make it too tasking, but like has been repeated over and over and over again, you are the bridge. And if you don't know, if you can't identify the common skin disorders, not for you to try to treat them, but for you to know when to repair, then we have not really done enough, have we? So whilst this is not a lecture, we're going to use pictures to just show common skin disorders, and hopefully we move through. Because they are common. They are common. They are everywhere. Are we pointing? Okay. So the objective of this session is just to provide essential knowledge. We've been taking time to ask, who are the people here? Some of you are not doctors, quite a number of doctors, general practitioners, and then you. So if you're not a doctor, at least you'll probably be working with a doctor, but good for you to know this. The pharmacist was speaking. Sometimes the patients are coming to you, and we have pharmacists who are consulting and prescribing. Consultant pharmacist. Okay. My hands are clean. The objective is to improve diagnosis, manage, and to refer properly. So what are the most common skin disorders and which ones do you know? Again, like I said, I don't want to do lecture. So just raise. So what common skin disorders do you know? Acne vulgaris, yes. Tinea versicolor, if I ask you properly, we'll hope you know, yeah. Eczema means many things to dermatologists, yes. Scabies, love it. Please give her a round of applause. Yes. Ringworm, okay. Psoriasis, big grammar, yes. Like we have competitors here. Well, you remember that the skin is the largest organ of the body. You remember, it is. We're not just boasting. It is the largest organ of the body. And the important thing about the skin is that it tells you who you are from a distance. It tells people who you are from a distance. It tells all the things you've been doing. It tells if you've been sleeping well, if you've been eating well, if you've been drinking water, if you've been in skin. It tells a lot, okay? It's also that house, as it were, without looking inside yet. It's the house. So it's protecting us from the outside. It fights germs. It keeps us warm and cool. It has thermoregulatory function. And like I said, it's a reflection of the overall state of health. When the drama was going on, you heard the doctor, my colleague, hopefully not the real one, not the one that will do things outside, saying the way the brain, the way you can have heart failure, the way you can have kidney failure, the way you can have liver failure, it's the same way you can have skin failure, but people don't really know. It gives a lot of information about our overall health. And the functions of the skin, this is, if you ask the people who speak skinese about functions of the skin, we can go to town. But general, just put it like that. Protection, we talked about it, that when the skin is not breached, then it takes a lot of things and they will stay away. That's the whole point about germs. That should you be using many things to take care of germs, as it were? No, the skin germs are supposed to be there. They are commensals. Like the vigilante of an estate. And you remove vigilante, who comes in? Armed robbers, right? Thank you. The Agberos are Monile. Remove them, problem. So it's protecting for a reason. So don't remove some things. Regulation, we talk about thermoregulation when you're cold or when you're hot. Vasodilatation, vasoconstriction, the hair stand on end, many things. Sensation, if you have a problem with your skin, I remember that you have nerves and your fingertips and all of those things. They help you feel. They help you know that something is coming. They help you sense danger. You can move away. If you have been unwell for a very, very long time, or you have or your skin is shedding for a long time, you might not feel sensation so much. So it does have all of those thermoregulatory sensory functions. Metabolism, the skin is the house of vitamin D. It helps you to do all of those regulation. And even sweat, sweat regulation, all of those things, it's helping you metabolate and do your metabolism. And who knows about the skin's communicative abilities? Can you think about it? Do you know that your skin can talk to everybody? We just started by saying that the skin tells a lot of information. The skin actually helps you. The skin actually can tell you, I like you. How? You're blushing. I like you. I'm shy. In the very first person, you can actually see redness. So the skin is communicating something. Sometimes your skin tells people for a very long time that this person has not been going out. You look pale. Do you understand? So it has a lot of information just for those who can discern that information. And the physiological components of the skin, we're not writing exams, but just put it out here that we have proteins that give you that structure that makes the skin intact. And the lipids and the sebum that help you with the moisturizing. And when they are dragged out or when they are not enough, then you feel drier and they have problems with dryness. And it has antimicrobial peptides. Most of the microorganisms on the skin actually exist in a state to make sure that the skin can protect you properly. And of course, what people think that skin is all about is the color. Eumelanin, which is the dark melanin that gives us color, and the pheomelanin, which is the lighter colored melanin that actually makes some people a little bit lighter. Then we have natural moisturizing factors, what we call NMF, that so they just help when your skin is in right temperature and pressure, as it were. When the skin is intact, it keeps your skin is like the brick and mortar, and then the moisturizing stays intact. But you might, because you're having your bath and you're exposed to the evidence, you might actually have to top up. That's why we always encourage you to have your emollients. And obviously sweat, which helps you thermoregulate, but people think that when you sweat is a bad thing. Sweat actually helps you. It is when you have microbial activation of the sweat that you now have the smell that people think. So there's a difference between antiperspirant and deodorant. We don't want you not to sweat. So those are good things. And this is all I've been talking about, that skin microbiome. Before, when we didn't know enough, a long time ago, we didn't realize the importance of all the different germs, as it were, that were on the skin, which make up the microbiome. But now we know that you have natural fungi, we have viruses, we have bacteria that help keep the skin at a balance. And when things are in that right balance, that's why we talk about pH and sebum and all the right things are supposed to be there. Then the skin is intact. It's the true Voltron, and it does everything it's supposed to do for you. And this same microbiome is also similar to our gut microbiome. If you ask the gastroenterologist, they tell you that there are supposed to be some germs that are there in the gut. So the skin and the guts, they speak a language. They're kind of very interrelated. And this is why sometimes in the gut we talk about probiotics, prebiotics, because we're like things to encourage the natural flora of the gut to help even your gut function properly, as it were. When you now have a diversity that is abnormal, because we've said that the skin is diverse, but when we now have an abnormal diversity, as it were, we can now have what we term inflammatory diseases. This is where things like psoriasis and AD, atopic dermatitis, acne, and even aging come into play. So the importance of this background is such that when you are attempting to help a patient that has a skin disorder, if you don't know many things that the skin does, you might seemingly overcorrect and tip the body the other way. There are some things that if you go to a medical doctor, a dermatologist, and you present yourself that this is this, they'll tell you, you know what, don't worry about this, it will be fine. You'll be looking at the doctor with suspicion. So we have also learned that because patients come to you and must take medicine, we will give you medicine. Abi, that medicine is called what? Placebo. Placebo. Now, depending on the person's grammar, that placebo can be very expensive because that's the language you want to hear. Do you understand? Depending on the person's, I always tell patients that I'm as good a doctor as you make me. You have to trust me that what I'm saying is good enough for you and it works. But when you look at the doctors are very discerning. When they look at the patient, you said to, okay, this patient is not, I like Boron Lele, okay, no problem. Prescribe. I'll tell my house, right? No, this one, this is the most important one. It's okay. It's vitamin C in a different form. Because there are some things that we shouldn't correct. But because the patients don't know it all, and depending on how busy your clinic is, if you're a doctor or if you're a pharmacist and you're thinking, really, I don't have time for this person, please take. This is very important. So there are some times that you don't change the formula, but you always have to try and win the patient over to understand where it is that you're going or trying to take them to. So let's look at the common skin disorders that we see across the country, not just in Lagos. You called acne vulgaris. People said tinea or pityriasis versicolor. So very good if you said that. Seborrheic dermatitis. Some people don't realize that dandruff. So seborrheic scalp seborrheic dermatitis Zika is dandruff. Some people think dandruff is just regular. Product buildup is different from dandruff. Atopic dermatitis, keloids, urticaria, which is a very annoying condition. Superficial fungal infections, tinea, somebody talked about tinea corporis, ringworm, and nail infections. These are all superficial fungal infections. Scabies is extremely common, and scabies is something we don't like to be disturbed because we think that the GPs and the medical officers should have been able to fix it, but some people can't even identify scabies. Genital warts getting more and more common because, like I tell my medical students, genital warts is a sexually transmissible, not sexually transmitted. They're two different things. Sexually transmissible, which means you don't necessarily have to have intercourse for you to have genital warts. Everybody knows Brother Mofe. Who knows Brother Mofe? You don't know Brother Mofe? Come, let me show you Brother Mofe. Come. Sexually transmitted and sexually transmissible. Be coming to me. Come. I don't want now. I don't want now. You don't get it? You don't get it? When Netflix are chilling. Oh, do you get that one? You do get? This who doesn't get? Netflix and chilling. Yeah, come, be coming. No, do like you like me. No, come well now, come well. No, I don't want now. So the bottom line is that you are having a relationship, you are playing, but you are not having penetrative. However, you are playing. The play get level. Because the virus is skin-to-skin transmission, kind of like the way scabies is. You can go and sit down. So when patients, and this is important because sometimes, the reason why I'm even bringing this word up is that some patients have come, the pharmacist has seen, and the pharmacist has seemingly treated. So I'm looking, a pharmacist looks down there, pharmacist assistant. Where are they? They've gone. Pharmacist, I don't know, she said something, consultant pharmacist, what was it? I don't remember. Anyway, so where do you stop your own treatment? Because that's quite invasive for somebody to be looking down there and you're not a doctor. I'm just wondering, there's some things that I'm not clear about. But what I'm trying to explain is that sometimes you erroneously think that this has happened for this particular patient to have this problem. Meanwhile, you don't know the pathos completely. So scabies, genital warts are sexually transmissible disease, not necessarily sexually transmitted. So the story tells a lot. Vitiligo, pigmentary disorders, and various alopecia, hair loss. Oh, very sad. Alopecia, because we have competition. You know, Dr. TikTok, Instagram, Snapchatters, everybody, Facebook, mother-in-law, mother, sister, brother, all our senior colleagues. Everybody but the people that are supposed to treat you. I had a patient who came to us. I shared this on our NAT forum. She had patchy hair loss. People said it was alopecia areata. Somebody told her that if you use on TikTok or Instagram, if you use onion water, it will grow your hair. Please, has anybody heard that one before? You've heard it. And rice, no, I've heard rice water, I've not heard onion water. So she used onion water for herself and her entire family, all her children. Then the children's hair grew. Her own she started losing. She now came to us with very patchy hair loss that was even scarring. Guess what? At that time, I was still screaming that, oh my God, how did you do this? Thinking it was irritant contact dermatitis. It turned out that she had triggered, Dr. Akinkugwe, she had triggered lupus. It was. She had triggered systemic lupus erythematosus. She had triggered, because that's an autoimmune condition that on its own it will be there until the right temperature and pressure, as it were, STP. So onion water has turned to lupus. Even we were like, oh my God. So now we're dealing with an autoimmune condition that really, really has no cure. So, you have to be very careful. These are our colleagues. This was, so just to let you know how we got that common diseases. These are studies that were done. This is one of our colleagues in Calabar, a professor of dermatology, Professor Henshaw, and it showed that atopic dermatitis very high and tinea, acne going down in common clinics. So these are the things that we see. So they are the common disorders. Now we know about acne. You see, this is a male patient. The irony is that many females will present to us more because they are seemingly more concerned. But the very serious acneiform eruptions are in male because it's a male hormone-driven disorder, androgen-driven disorder, that is very common inflammatory disorder of the pilosebaceous units. And we know that adolescents and young adults have it, and it persists into adulthood. Now we are seeing 30-year-olds with acne because it's not regular acne anymore. They are now having steroid acne, not just acne vulgaris. And the problem with acne is four-pronged for the most part. When the hormone is driven, when the hormones become driven in adolescence or puberty, there is increased sebum production, and you have what we call follicular hyperkeratinization. Then the bacterium that is on the skin, cutis bacterium acnes, now becomes kind of like happy. It is, there's a bit of a colonization in the sebum, and then you have inflammation. Some people will have just tiny comedones. Children. Some others will have huge furuncles or pustules. So we talk about inflammatory and non-inflammatory acne. Toothpaste cannot work in any of those pathogenesis. Toothpaste cannot work. So when what was that landlord that was using toothpaste and lime and bleach and hypo, where are you causing? So sometimes when we hear patients, yesterday's Quaker oats and tomorrow's tomatoes to rub, I don't understand. I'm looking, but I guess I'm the one that went to school. Then we have, and then of course they have increased seborrhea. So that's another problem. People think that if you have very dry face, you will not have acne. The irony, remember I talked about the functions of the skin and how we have to have sebum, right? And we talk about natural moisturizing factor. Your skin is actually better when it is well moisturized. The fact that you are shining does not mean bad. It doesn't mean bad. And we've moved. There was a time people thought matte skin was in. Now, sheen is in. Glassy skin, which has the sheen. So some people will even put oil on their face and say, oh, I'm glowing. I'm like, we're confused. We're a very confused lot, okay? And one of the major problems with acne is the hyperpigmentation, especially in black skin. The reason why hyperpigmentation, what we will now term post-inflammatory hyperpigmentation, happens in acne is usually because people don't leave their face alone. People always wanting to help it. Just help me pop. Dr. Pimple Popper, don't pop any pimple. Most times your black skin will heal with hyperpigmentation. If you harass the skin enough, even when you are, that's why we also say don't scrub. Because every time you break the skin, it is an insult to the body, and the body will respond with color because it wants to repair. It's trying to help you, okay? And that's color repair now becomes a problem. You now use many colors, many things to try and fix that color. So you see it's almost like a vicious cycle. So what are the topical treatments? I'm usually wary when we say this. Dr. Folakemi Cole is very big on social media. She's always pushing all those things. Me, I'm seeing the problem that some information is bringing to me. Because they will say, somebody said we should use this. And they will use it all and come to me and tell me, I've used everything. Whether they use it for 5 minutes or 5 days or 10 months is a different matter. You are hearing information and you take 1/4 of the information and fling 3/4 away. and I have a problem. So we have to be careful. But for the most part, benzoyl peroxide, because it works on the C. acnes, retinoids because it works on the follicular hyperkeratinization, are the most important. They are the baseline acne treatments. But topically, those are the things we use. When we have inflammatory acne, then we bring in the oral medication, usually oral antibiotics like doxycycline, or when we have the right indication, oral isotretinoins. The pharmacist is left. I'm hearing a lot of patients going over the counter to buy Accutane. Forgive my trade name. There are other ones. Isotretinoin is not supposed to be sold easily. I'm talking to us as colleagues, as people in the healthcare industry. You're not supposed to. It's actually not even an over-the-counter medication. It's prescription-only medication. But our colleagues are doing harm. Because when you think you are helping, because the patient, like the lady that came and said, she has the wedding in 3 days. So this actually, I have a wedding next week. I said, go for your wedding and come back home. That's what I tell them. Go and come back. No, but doctor, it has to cure. And I said, no, please go and use makeup artist to do that one. Come and meet me, then we will take care of it. I'm not in any hurry. You shouldn't be. Do you understand? You have to stand your ground. And if they leave you and go to another pharmacist, fine. Your own will come to you. Abi, what's yours is yours, right? So if you're worried about losing business, tell yourself that, okay, I've put a ripple effect. All right? So these are the other things, pH, balance cleansers, exfoliants. This problem of alpha, AHAs, BHAs, everybody, please. I'm begging you people. This is all some people do now. AHA, BHA, AHA, BHA. Please. Too many acids are causing the skin to be sensitive. So many of them come down with burning, stinging skin. It's because they have heard us say that it is good. But in what combination, at what times? We have to be very careful. All these things, leave them to us. They should come and meet us. Tinea vesicolor, what people will normally say, ELA. Yes? So it's a fungal infection caused by Malassezia furfur. This is very, very, it's easy to see. When you see them at the back of their neck, sometimes it's grayish, sometimes it's kind of lightish, as if you want to dust it all off. That's tinea vesicolor. It's fungal overgrowth. Most times we would use antifungals or selenium sulfide or zinc parathione, heads and shoulders 2% to try and correct it. We talked about acne. Oh, sorry, I'm going the other way. Seborrheic dermatitis. You can see this young man. So dandruff is different from this. So this is follicular seborrheic dermatitis. And you can see the hairline here, discolorations. Most times, they may be doing some other things that will worsen it. Sometimes you have to check what their habits are. Some of them are doing some gyming and they are keeping the sweat on for too long. They don't go wash off. So you have a bit of a fungal overgrowth. So you need to find out what is going on exactly before we manage. Again, we can give them, if it's very severe, we give them oral medication. Otherwise, topicals will do well. But for the most part, we listen to what they are doing and help their habits. Atopic dermatitis, this is a big one because it is not a simple problem to solve, simply because everybody has to be involved. A lot of the patients, children or young adults or even adults, have to have things, maybe even go to the home and we do home therapy and see what is going on. It's not one cause that has a solution. It's a multifactorial problem: environment, lifestyle, home, genetics, what you use on your skin, and all the other things. AD is a big deal, but it's a very common thing. Most times we try to find out who else in the family has atopic predisposition, and then we can now bring it up together. Some people are very subtle, some people have it worse. But for the most part, you notice it in the flexures. So you can see the neck flexures, ankle flexures, cubital fossa, popliteal fossa. Every fold, you see hyperpigmentation and lichenification, thickening. And the patient is almost always itchy and they are very dry. So emollients are very big in trying to manage atopic dermatitis, but there are newer medications including disease-modifying agents, methotrexate, cyclosporine, JAK inhibitors, biologics like dupilumab. There are so many things that are being used for AD now. AD is a big one. AD is big. Keloids, some people have attempted because they hear that dermatologists give intralesional injections. Keloids, if you don't respect your
yourself, keloid can come and cover your entire head. So you need to be careful when you see a patient with keloids. I would advise that just send to us. And when I say us, yes, the dermatologist or the plastic surgeon. But even the plastic surgeon send them back to us because they're afraid. Because the way the skin, the black skin flows, when you traumatize an area, anybody who is keloid prone will have even worse keloid. So when you even think you want to help, there is a help that is not helping.
Urticaria is also known as hives, transient wheals that are extremely itchy, and they can happen all over the body. Usually, we'll say, okay, if we can find the cause, we'll take care of it. But most times you can see that they are flesh-colored swellings, but when you press them, they disappear. That's urticaria. Everybody now feels that they have urticaria because they say they check. They say, I'm sorry, I have hives. When you come, we can do certain tests and to find out. Sometimes you are lucky. Seafood, some people have NSAIDs, maybe they're using ibuprofen for their periods. They can now have all of this sort of things. There are different causes. But the management really is to find the trigger and avoid the trigger. Prednisolone is not what we brought this one out because a lot of people find it and they just give them prednisolone. We don't like it. It causes too much trouble. Too much trouble, please. Then we've talked about superficial fungal infections. The problem with this thing that is here is very common under people's breath. I'm always feeling sorry for men. I say when women wear clothes, you don't know what they're hiding. Forgive me. It's true. And this is, I will not lie, Dr. Akingbedi want to call the name. I will call the name. Funbact A, Skinil, Tidy Nil, their brother, their sister, Quadrigem, Endix G. I will call all the names because if you like, come and arrest me today. You are causing too much problem to us. Triple action, quadruple action medications are causing problems. And they are medications, but people are using them as normal. How will you not come down with this? Men and women all put together, they all have this. You can see now this one is even becoming candida because you have spores. Please, everybody, be very careful. Scabies. Scabies is something that, please, if you take nothing away, everybody just look at this one. And the story tells the difference. With scabies, you will hear particularly that the itching is worse at night. If it's a child, the person may just say, I'm always itching, but most times it's when they want to sleep off. If it's an adult, it's worse at night because during the day, they are distracted, they are busy. But it can be very bad that they are talking to you and they're doing like this. And they, they're just talking, they're not quite there. They say, it can be very, very bad on a more serious note. And when people are used to looking in between and seeing the nodule, sometimes you may not see it, but you see evidence of severe scratching, so it will be broken. All right? Evidence of that. And then you also check under the wristwatch, so the wrist folds. So wherever had been a little bit covered, you just check, you will see it. But hear the story. Scabies is sexually transmissible. So in adults, you will see that they are sexually active. But in children, you will not have any evidence of that. So you look for contacts. And how do we take care of scabies? Most times you are supposed to use permethrin all over, and then you give ivermectin to the entire household, not just those who have it. We have formula. This is the only time we prescribe medicated soap. What is the medicated soap we use? We have a very fantastic audience. Liking planners, if you even think that is liking planners, please just send them to us. No need. Psoriasis, the same thing. Send them to us, please. Very bad, silvery scales, looking like very, very thick dandruff in many places, but it's more. All right? Don't attempt. Pseudo folliculitis barbae, very common back of most males. We don't tend to see it in females too much because we don't shave, but you find out that it's their barbing practice, their shaving practices, so we tell them what to do. It's not to be giving corticosteroids unnecessarily. All right? Vitiligo, if it is early, we may be able to help them do something about it, but we're just trying to show you pictures, okay? So I'm just going to end quickly. Alopecia areata, please, people will send them to us. Please, please. I talked about lupus. If you remotely think of systemic lupus, please don't waste time. So I've shown you what is common, what you should do, and then the things that you're not too sure about, send to us. We can take these out. They are very common, looking like acne, but not quite. When you see them, send to us. We can take them out. Please do not give them any medicines. I'm sorry, I should have given you a heads up. Disgusting things, forgive us. But with these are the things we deal with, so feel sorry for us. All right, I will end with what we talked about hyperpigmentation, and then the burden, we don't want all of that. Okay, I think yeah. So we started with this and we're ending. I hope you can identify common skin disorders now. Thank you all for listening.
Thank you very much, Dr. Herrera. We're really sorry. We're trying to make sure we finish. We said we'll finish around 6, but unfortunately, we won't have questions for this session, but I'm sure it was quite informative. I want to share with you an advocacy toolkit. I'm not sure if the QR code is here. Oh, it's not on this slide. Okay, we'll have to upload the slide. But the advocacy toolkit if it's not shared, will be sent to everyone. It's just, let me see if I can project it. So it's just something that you can have to be able to share with your patients, so that when you see people, you know how to talk to them, talk about them. Sorry. Sorry. Yeah, you can take it off. So we need to share with them share with you so that if you have patients, you know what to say and some of the signs and symptoms and all that. So let me see if I can get that. But while we are here, can we just maybe take pictures, come together while I sort out, so to save time, so we can leave. So we have a picture session. We can have everyone in the front, take a group photo. You can take different photos together and call it a day. So bring the World Skin Health Day plaque so that we can use that to take photos and then leave it. So leave your bags, leave everything. We are all here. We can just come up and take a picture together. Let me see if I can sort out that stuff. Hold on. phone. So this is digital age now. We don't print again. Everything is online. So please scan the toolkit and download it, and then you can read through basically everything that we would like to do for skin health advocacy. Thank you.
Everyone going through something. No peace, only me get something for my head. As long as my heart is pumping, just believe, say, joy is coming. What?
Opportunity show up every day. Go get that money, go get that pay. When things are bad, when things are shaky. Oh my God, no go for free. Stand up, see where the ball. Only bush a jet, but you can't give up. Allow yourself to grow. Okay. On my neck is diamond. I want them to diamond. See me cut down. On my wrist is a rose gold. But you get them go low. If I do, that guy know the show up. Now they show up, but I they keep on money low. Can I moto to my first nation? Call me K, call me Posha. I ever pay what my pay shit. I'm a got out on fly my jet. I got a long far away. Wash your pan on me, motu turn up. Wash your pan on me, motu shana see. Badu. Alone. Wash your pan on me, motu turn up. Wash your pan on me, motu shana see. Badu. Alone. Blessings follow me differently. Oh, yeah, cause I want to me. After many years, after let's go and find.
No be for you, you go do good.